Can you see the slides? Excellent. Just going to give participants a couple of more minutes to come into the Zoom link, and then we will start. Wa alaikum assalam. Good morning. Okay, excellent. Right, so welcome everyone to our course for this lovely day, Introduction to Health Research. We will be spending the next few hours together. It's a bit intense, but very fruitful course that you will learn about research and improve the way you think about research and understand the specific phases that a researcher goes through. So I'm assuming that you have some background in research, but perhaps not someone who is involved in research. So that's one background. The second background is probably you have some experience, so you've included yourself in some research projects, but maybe have not gone into a full-fledged project on your own. As health practitioners, we are always involved in research, whether as readers or as writers. So whatever the case may be for you, this course is highly, highly relevant. During the course, feel free to write in the chat. I'll be checking in every few minutes to see if you have any comments. And it's best to be interactive and to engage further. That's the way to learn. So merely listening to me is not enough. You have to kind of contribute and see what your colleagues are sharing in the chat as well. Okay. So please allow me to introduce myself. My name is Lulu Al-Wazan. I'm a physician by background with graduate training in medical education and public health. Currently, I'm the chairperson for the Department of Medical Education. I'm also the head of the Assessment and Examination Unit at Imam Muhammad ibn Saud Islamic University. The role I take is highly research involved. If you take a picture of the screenshot, the barcode on the right, it will take you to my LinkedIn. Please feel free to connect. I love to hear from people and to discuss the ideas even beyond the course. In our time together, we will be covering the following learning outcomes. First, we're going to identify the basics of health research. This is a very essential first step. Some of you might know some of the ideas we mentioned, and some might be new to you. Then we will recognize the different research designs and methodologies. Not all research is done in the same way, okay? So one starts with a research question, perhaps, and then you have to decide how am I going to answer this research question? There are different research designs. There's quantitative, there's qualitative, there's mixed, there's narrative analysis, there's interviews, there's questionnaires, there's literature reviews. So there are very different ways of trying to answer research question, and we will deep dive into that in our next learning outcome. The third learning outcome for today is to explain how to criticize literature. So one essential component of being a researcher or being involved in research is being able to read research. So a lot of us, when I say research, they think about the conducting the questionnaire, collecting the data. صح ولا؟ This is what you think when I say research. But actually, research is much more. It's about reading previous work. Sure, the slides will be shared later. Reading previous work and critically analyzing what others have done before you. So let's say, for example, you saw something in the clinic and you thought, oh, well, this is an interesting syndrome. I've never seen this symptom in this disease. I wonder if someone else has experienced this or saw something like this in their clinic. Once you have that question, where do you go? You want to read up more about this symptom that is uncommon in this disease. What do? You probably will go on Google and you'll search. Or PubMed and you will search. For example, let's say you saw a patient who has hypothyroidism and they have hypotonia. And you want to read more about that. You probably are going to get on PubMed or Up to Date and you're going to research hypotonia and hypothyroidism, and you're going to read what others before you have seen in their own clinics. Like them, you have a responsibility as a health practitioner to report the unique things, the different things that you do in your work context, so that others learn from you in the same vein that you are learning from them. So this is an important area that we will be talking about today, how to read the literature and how to criticize the literature. After that, we're going to talk about the sources. Is it enough to hop onto Google and to write hypotonia and see what comes up? It is not enough. Google is for laymen. So it's not for your use as a health practitioner, okay? You can start there. That's okay. But to actually have proper sources, there are databases that we can be using. They can be primary or secondary sources, and we will get into that more deeply later this afternoon. Once you have understood the sources that can be used to gain information that is scientifically based, you're probably going to want to write your own ideas based on the ideas of those who came before you. So there's a specific way to write literature and literature reviews. This is an essential component of being a scholar. So some of us might be reading and digesting the information and expanding their knowledge, but a lot of us will be going to the next step, which is writing a paper, writing a literature review, trying to summarize the ideas and to critically analyze. Writing in research is very specific. It's not like writing a note for your patient, for example, where you're just plainly describing your clinical observations. In literature reviews and in scholarly writing more generally, you will be talking about things from different points of view. You will be taking different articles and saying, well, you know, so-and-so said this and this about hypotonia, and so said this about hypotonia, and these are opposing points. And in my opinion, there's a discrepancy in what is reported in the literature. There's no agreement. I think the reason for no agreement is because we have not done, for example, a national cohort study. You see, now I didn't just present the literature. This is not enough to describe, to say, oh, so-and-so said, so-and-so said. No, you have to give me a new idea. So what so-and-so said? As I've given in the example, sometimes there's discrepancies in the literature. And once that's the case, you want to present things in a nuanced way, and you would probably need to explain why. And of course, your explanation should be based on your scientific opinion. I think there's hands raised. Let me see. تفضلي فاطمة. تفضل ماجد. Your mic is open now. تفضلي عايشة. Or was that by mistake? Okay. Also later this afternoon, we will be talking about the importance of understanding plagiarism and the consequences of plagiarizing research. This is a very, very important point. When writing about different diseases and ideas in research, you'll find that it's quite easy to copy-paste sentences, you want to remember them later. Sometimes you don't reference appropriately, and you fall victim to plagiarism. This is very crucial to understand that it's not okay to do that. Also, nowadays, we are using ChatGPT and different AI modalities to help us in our material write-up. That's not yet the ethics around using these tools to do the writing for you. Still, there's a question mark there, and it's a point of discussion. But it's important for us in this course to understand plagiarism and how plagiarism influences us as authors and how to avoid it. Finally, we will end with how, once I have this literature review and I've understood how to do things in research, how do I then apply scientific literature? This is a crucial point. And in order to be considered a full-fledged researcher, it's important to take what you have learned and apply it into practice. Okay, so this is an important step to do. So it's not reading researches on one side, and then you're practicing something different. How do you then take what you learned and put it into practice? This is an essential step for any researcher. Okay, so these are the learning outcomes for today. I understand that the course might be a little bit heavy and intense, but I promise you it is, they are light ideas in themselves. So don't worry so much about how hard it's going to be. There are many examples that we will be discussing throughout the day. It will make it easier for you to understand and grasp the ideas. At the end of this course, the idea is not to have you write a whole research paper. No, this is only an introduction to health research. So through this course, what I would like you to, the takeaway message is to have a better understanding of research. Okay. Have the ability to discuss scientific research with others. Also, the takeaway is now I need articles in my own practice. So I want dialysis, dialysis and nursing practice. Where do I go? What kind of sources do I need to find in order to do this, to understand my practice better? So this is the outcome of this course. So no, you will not be able to write a research paper after this, after today, but you will be better able to have a conversation about research, and you will be better able to find resources that help you perform better in your practice. I agree with that. AI is a very important aspect that we should be discussing more in research and beyond. Okay, so is this clear so far, the learning outcomes? Okay. So let's look at our roadmap for today. We have 6 steps to go through, and I already mentioned briefly what they are. We will introduce health research, so a bit of defining and explaining the context we're in. So this is our first step. Then we will be talking about research design and methodology, and there are many ways to do research. So we will have an overview of all the different ways you can do that. Step 3, we will be talking about the literature review, and then we will talk about how do you construct a simple search query for beginners. So if you have never used PubMed, or maybe if you used it lightly, I will explain to you how to research. So for example, you want to find out how hypothyroidism manifests in pediatric age groups, for example. There are different algorithms that you can use that can produce better results for you. So we will be talking about that a little bit later. And then we will be talking about primary and secondary sources, as I've mentioned earlier. So without further ado, can you see the screen? Okay, let me just give me a minute to reshare this. Okay. Majid, your mic is open and you've raised your hand again, so please feel free to speak up. If you are speaking, I can't hear you. You might want to write in the chat. All right. So let's start with a question. What do you know about research? Go ahead and write in the chat the first thing that comes to your mind. Okay. الجندلي, there's sound, so your colleagues are participating. Double check from your side. Okay, so Dana says, research is a trial of, do you mean clinical trials, Dana? Mustafa says, it's a problem that needs a solution. I agree with you, Mustafa. An investigation, collecting data to find out the reason for something. It's a systemic process. Excellent. To answer questions, finding an answer, a topic that needs more study and information. Excellent, Jamal. Creation of new knowledge. I agree with you. A way for scientists and other researchers to find out information about a particular topic or to answer a specific question. Excellent. Yes, making sure of information. Sometimes we do have information, but we're not so for example, using certain medications. Sometimes we're not sure if it treats that it's effective as a medication or if it was just for certain patients, it's working for certain patients. So you need to do more studies in order to determine the effectiveness and efficiency of a certain drugs. I agree. Okay, so if I can summarize what has been shared in the chat, we all agree that there's a problem. And research is about looking for solutions or answers to problems that we face in practice. This is something we can agree on. There were some notes about how to do research, so experimental design. Yes, I agree with you. That's defining research. But what is the essence of research? The essence of research is problem solving. So we have issues that we face in context, and we use certain tools and methodologies to answer them or to find better solutions. Okay, super. Let's talk about why people think research is sometimes difficult. So you'll notice not every health professional is involved in research, whether reading it or writing it. And some schools put a lot of emphasis on scholarship and research, while other schools don't pay much attention to it. There's also variation between schools. So for example, certain health professional schools, they don't teach research in their program, while others teach it heavily. So you'll find 3-4 courses within the curriculum talking about research and methodology, epidemiology of disease, and these kinds of things, okay? So why do individuals think research is difficult? The number one reason is being ill-prepared. So not being prepared for research, and as I've mentioned, it's not the individual's fault most of the time. Sometimes you are in a undergraduate program that prepares you well for practice, but does not give much attention to research. And there are reasons why programs traditionally were designed in that way. Oftentimes they'll say, I want someone who can practice in the field. And if they want to do research, they can do a master's or a PhD later on, and then they will learn about practice there. about research there. That's an okay point, but nowadays with the transformation program, health transformation program, and the need to equip health practitioners who are lifelong learners, so you are responsible for your learning, it's essential for you to read research and to know how to use databases and to find information. Do we agree on this? So that means you should be, as a health practitioner, prepared from a very early stage on how to deal with the finding the information, making sure the information is sound, making sure you have the ability to appraise information. Is it good information? Is it bad information? Should I use it in practice? Is this study good? When I read the recommendations, should I perform them? How do I make that decision? Okay. So essentially, the research in and of itself is not difficult. It's not difficult to do research, but you might be not taught or trained properly. No matter if you did not gain that training in your undergrad, you can still be prepared through professional development, like this program we are doing now. And I promise you, if you commit yourself to certain research projects and you learn as you go and you attend more courses, specialized courses, you'll become a very competent researcher. So that's reason number one. Is that understood? So you're not allowed to say anymore, I don't like research. I don't want to do research. I don't understand research. No, you were not trained for research. It wasn't part of your training. So that's why you find difficulty now. Nowadays, when we're designing curricula for health professions, we always include research. We don't have any graduates who go into the workforce who are ill-prepared. We now know that it's essential to have research as a competency. So it's taught earlier and as an integral part of undergraduate programs, okay? Let's discuss the second reason. Individuals have the wrong perceptions about research. So some people, when you ask them in the exercise we did just now, what does research mean to you? Some will answer, to do an experiment, for example. But research is not just doing experiments. Or they will say it's clinical trials with medications and animals. Okay, that's one research methodology, but it's not the only way. Other people might say, research is about numbers, doing numbers, okay? And I don't like numbers, so I don't like the math, the statistics that is involved. So I'm not going to do research. Research is not just about numbers. It can be qualitative. So doing interviews, focus groups, that might be something you would be interested in doing. So having a full understanding about what research is allows you to make better decisions about what kind of research you will be involved in. The issue, as I mentioned, is lots of people have wrong perceptions about it. Okay, so they think, oh, research is doing a big clinical trial in a tertiary hospital and involving patients. No, not all research is like this. Oh, research is about numbers, and I don't like to do statistics and difficult calculations. No, not all research is about numbers. It can be about literature reviews. It can be about systematic reviews. It can be about case studies. There are different ways to do research, and we will learn about that today. And you might find that you like one research design better than the other. The third reason is individuals have difficulty in formulating a research question. So there's a specific way for us to come up with research questions, and it's essential for us to understand how to generate research questions. That's an essential first step in any research project. Luckily, nowadays, there's a lot of emphasis on innovation and generating new ideas. For me, I don't find it to be quite difficult to find a research question. You know why? Because we all practice. So in practice, you always will face issues. You will always notice something in your working environment. So you see one thing in the clinic or in the OR or in your office, and you'll think, there's I wonder why we do it this way. I wonder if there's a better way to do this. Okay, so this is probably one of the weakest reasons for me when people say, I don't know where to get a research question from. Research question comes from the context. You are practicing, you will notice something, and from there, you can start researching. Also, if I cannot generate research questions on my own, if you read research articles, they always have in the recommendations at the bottom, they will always say, we did this in our study, but future studies should have a bigger sample or should do qualitative research, or should use a mixed methodology. So you start not from scratch, but from where others have stopped. So they will give you the idea. Okay, so this is essential. I promise you, if you read research, so this is the starting point. If you know how to find literature and read literature, it will make you better able to generate questions and to understand research methodology. Okay, so people who don't read research, it's very difficult for them to formulate research questions or to come up with ideas for research. Using the library resources is essential. So the databases that we have available to us help us greatly in finding the information we need. The problem is a lot of people, they don't know how to use them or how to gain access to them. So they end up researching things on Google, and sometimes in Google, links that are not appropriate scientifically come up and are used by health practitioners. Actually, as health practitioners, we have specific sources that we need to be depending on. You cannot depend on Wikipedia. This is inappropriate. So that's one of the reasons people think research is difficult is, oh, how do I gain access to PubMed? I don't know how to use the algorithm, or I'm not sure what word to use, what keyword. So we will be talking about that later on today, and you'll be able to do it. One interesting experience that is not uncommon is some of us have done masters and PhDs and fellowships, and we've done research before. And as you know, you will be paired off with a supervisor, oftentimes someone who is more senior to you and has more experience, and they will teach you about research. Unfortunately, sometimes you are paired with someone who doesn't fully understand the research process, or they themselves are less experienced, so they are not able to teach you fully. Here it's crucial to understand that research methodology, it really is self-directed. So you will learn from others, you will learn from me, you will learn from your colleagues at work, you will learn if you do more courses. However, much of research is self-directed. So you have to design a project, submit to IRB. In order to learn, you have to engage in the process of learning. So yes, you might have had an experience in your graduate work with someone who's not fully capable in research, but that does not mean that you stop there. You have to engage in the research process in order to learn. Okay, so if you don't do that, you will not be able to grow as a researcher. And depending on others, especially at this point in your career, you will face difficulty. Okay, so do we agree on the difficulties here? Do you have something to add? Do any of the reasons that I have mentioned resonate with you? Do any of the reasons resonate with you? So please write in the chat. Are you a beginner researcher? Are you someone who reads research? Are you someone who's experienced? And if you're not involved, what is the reason behind that? Are any of the reasons that I mentioned resonating with you? I agree with you, Nafisa. I think also it's not mentioned here in the slide, but you bring up an interesting point. Research is not done alone. You don't do research alone. You do research with others. So also choosing the right team for you is an essential component to your success as a scholar. So being involved with others who might have more experience or access to data in certain hospitals will enhance your project or enhance your experience in research. Sometimes, unfortunately, we have a research group that does not work well, or there's some difficulties in collecting the data. So, and then we end up having a bad experience with research. So this is essential to understand. Choosing the correct team, the right team for you, someone who understands, helps you perform better. Yes, Riham. A master's is a great place to start with research, and I'm sure you've learned a lot during the process. My advice to you is to continue. Take the skills that you learned and to perform more projects to hone your skills and ensure that you don't forget what you learned. I agree with you, Dana. Oftentimes, individuals shy away from research because, as you've mentioned, there's a lot of steps to take, especially if you're dealing with patients and data that is confidential. So you have to go through IRB and they have to ensure that you don't harm the patient. While these steps are sometimes annoying, they are essential to protecting the patient. So we have to respect that. Ethical approval, ensuring that your research is done soundly, is to protect the patient, their confidentiality, and their well-being. But the good news is once you understand, you do a few times, Dana, you submit a few times, you'll start to understand what is appropriate and what isn't. And in future projects, you will not make the same mistakes that you did in the first 2 or 3 applications that you submitted. That's why I'm really emphasizing on the importance of experiential learning. So the more time you spend doing research, okay, the more time you do commit to research, the better you will be able to navigate the system and understand what is required. Um, um, and what I recommend to my students oftentimes is, okay, you don't have to, if you're a beginner, don't start with, let me do a cohort study, let me go find the patient data questionnaires. How about you start with a literature review? You can publish a systematic review, you can do a narrative review. You don't need IRB for this. You can start today. If you have a good question and you have access to databases, you can start today. You don't have to go through all the hoops in a ethical review process, especially if you're a beginner. Okay, so this is essential. And this is why we recommend always to ensure that you are aware when you say, I want to do cohort or clinical trial. What does this require? Can you do it as a researcher? If you don't have experience, it might be difficult to do alone. So you might seek out a more superior supervisor, someone more senior to you and has more experience to help you and guide you in the process. Otherwise, start simple. This is a recommendation I always give. Do a literature review and see how you fare in doing that, because that doesn't require any ethical approval, or it's data that is present in databases and can be used by you. Okay. What I want from everyone, and as a result of the discussion we just had, what I want you to walk away with is research is not difficult, but there is challenges, and each of us might face different challenges than others. Once you understand what the challenge is, you can better perform. Okay, so you're not allowed after this slide and after today to say research is difficult. You're not allowed. From now on, understand the challenges and navigate the system better. Okay, so where do you start if you decide to do a research project? Where's the starting point? You can write in the chat. And I've already mentioned it. Exactly, I agree with you, Huda. First, you need to identify what the problem is. Okay, so selecting your topic is step number 1. Sometimes we say, oh, I'm interested in diabetes. I'm interested in diabetes as a disease. I'm interested in wound care in diabetes. I'm a nurse and I work in the ward, and I notice that our patients, they keep coming back with sores, and I'm not sure why our treatment is not working. Are we doing proper wound care? So you might see this in practice and say, oh, okay, how can I understand this issue a little bit more? You see how I'm thinking out loud? So identifying the problem is not a lot of the time the first thing that comes to your mind. What comes to your mind is the topic. So you think, oh, diabetes, we are seeing lots of diabetes patients. We are, there's something with wound care I'm noticing. Maybe we are not treating correctly, or maybe the patient is not following instructions at home. So you have these different broad ideas. This is your starting point. So selecting your topic. How do you select your topic? And how do you identify the problem? Well, you have to start from your work context. So what do you do at work? Okay. What do you do at work? It highly influences research. Actually, it's not accepted for you to do research in an area that's not your area. So for example, you are a nurse working in the ICU, and you decide that you want to do cohort study on pediatric age groups and eczema. But you are a nurse working in adult ICU. What's the relevance here? It's not relevant to your work practice. It's actually inappropriate to write about something that is not your specialty. So it's important to understand where the ideas come from. They have to be aligned with what you do for work. Okay, this is an essential step. Making sure that what you do research in is something that is relevant to what you do in your work context. Okay, so a question here might be, well, I've participated in projects with others. It's not my area, but I was involved. Yes, sometimes we can be involved in research projects that are not in our direct area of practice, but we are experts. We are experts in research methodology. So I'm someone who does ethnographic studies a lot. So I do it, for example, in medical education, I do it in internal medicine, and my colleagues in the pediatrics department, they've seen my work and they say, can we do an ethnographic study in the pediatrics department? And I say, yes, you can. And I am involved with them from a methodological perspective. So my input is about the methodology. Even though I'm not experienced, or I'm not a pediatrician. I'm not someone who practices in pediatrics. You see? So the main point here is how to select your topic from the work context. Okay, so always ensure that whatever idea you have, it is aligned with what you do in the inpatient care. Step 2, you have to refine your topic. As I've mentioned, first of all, you say, oh, I'm interested in diabetes. I see a lot of patients who are in the 50 to 60 age group. The wound care is not optimal. I'm wondering why. Okay, so now you have to refine the topics. That means you have to make your topic more focused. Okay, What do you do to refine your topic? Simply, you have to review the existing literature. So now you have an idea, wound care, diabetes. You get on the PubMed or uh, um, specific database that you are using, and you type in the search box wound care and diabetes mellitus. Wound care and diabetes mellitus type 2, for example. The database is going to generate articles for you. So it will give you a list of articles and tells you this is what has been written on this topic, okay? And we will demonstrate this later today when we're talking about the databases. Once you start reading, you will read the abstracts, the titles. You will notice that, oh, actually, there's a lot of research on wound care in type 2 diabetes, but there's nothing on type 1 diabetes, for example. Okay? And, but my interest is type 1 diabetes. So now what do you recognize? You recognize that, oh, the idea you are having has not been published a lot. And then you notice, okay, I'm noticing that there's a lot of articles now that I've typed type 2 diabetes and wound care. I've noticed there's a lot of articles on age groups 50 to 60, but I'm not noticing any articles on senior citizens, for example, 60 and above, 65 and above, older age groups. And my concern is with older age groups, for example. Okay. So once you start reading, the idea that you have, the essential crude idea that you had in the beginning becomes more mature. And now your research is more focused. Okay. After you've done this, you've done some reading, you've done some researching, and now the idea is clearer. Oh, I wanted to focus on wound care amongst age groups 60 to 70. Okay, I identify the objectives. And objectives should be SMART. So specific, measurable. These objectives are going to, it's an essential step to write really clear objectives, because once you write them, you know what you're supposed to do in this research project. So they start with verbs, action verbs. You'll say, I want to explore, for example, I want to explore wound care amongst elderly populations who have diabetes mellitus type 1. You see, my objective now is very clear, very, very clear. In the beginning, it was not clear. I'm like, I want diabetes. I'm thinking of wound care. Why is the patient not healing? And then once I start reading, I notice there are some gaps in the literature. And then I start identifying very clear objectives for my research project. If I say, oh, I want to do a research project on diabetes and wound care, okay, for who? Are you going to do a questionnaire, for example? Are you going to take all the patients in the clinic? Are you taking patients in this hospital? Are you going to take multi-institute? So you really have to identify the objective very, very clearly in order to come up with a manageable project. Okay. بالمناسبة, objective writing is not only for research. Whatever project management whatever project you do at work, I'm sure were involved in many research, many projects at work. You always have some objectives, correct? To define the scope of what you are doing. Research is the same. Research is the same. You have to identify what is the scope of your research based on your literature search, based on your work experience, okay? So once I define older age groups, okay, now it's clear to me. I'm not going to go handle pediatrics, or I'm not going to handle type 2 diabetes. I'm only talking about type 1 diabetes. That's what I'm seeing in practice. That's the gap that I noticed in the literature. So I'm going to focus on this group. This makes your research project manageable, so you can perform it. Let me tell you about some of the challenges researchers face in this area. They have broad objectives. So they do write objectives, but they are not specific enough. So they'll say, I want to explore wound care in diabetes, amongst diabetes patients, okay? When we go into the field to collect the data, we will probably pass out our questionnaire, or we will ask for patient files for 10,000 patients, because you said, I want diabetes. So there are 10,000 patients with diabetes, young, old, male, female, treated, untreated, controlled, not controlled, early, late, complication versus no complication, you see? So the hospital is going to give you 10,000 files, and they say, you asked for diabetes patients. We have 10,000. Is this manageable for you to do? Or for your team? It is not, Ghada. I agree. It's not manageable. So this ما كان أول شرط آخر سلام. If you identify the objective clearly from the beginning, you will not face these issues later on. So you'll say, no, my objective is to study wound care in this age group, an elderly population. I want them to be uncontrolled, or I want uncontrolled versus controlled. And I want it in the time period 2022 to 2024, 2 years. Not every patient from the 1990s until now. It's not manageable. So identifying your objectives is the area where you can ensure that your project is manageable and that it answers the questions that you have, okay? Now, notice it's plural objectives. So do we have one objective or more than one objective? In research, you usually have more than one objective, okay? So broadly, I'm talking about wound care in the elderly population in the so-and-so hospital in the past 2 years. But once you address this, you will have other objectives probably. So now we're talking about wound care. We might find in the literature that sometimes the challenge with wound care is from the patient. Sometimes the challenge is with the way we provide care. So it might be a second objective might be to explore patients' understanding of wound care. So now you have an objective that is related to the first one, and it will help you gain a fuller understanding. So you have some idea that maybe it's the patient, maybe it's how we provide care, maybe I need to interview the nurses in my ward, maybe I need to talk to the pharmacy and see what kind of wound care materials we have. That way you will have a second objective. So usually in research projects, we have about three to five. 3 is a good number to have for objectives, and they are related to one another. So this is an essential thing to understand. You should never write one research objective is to understand wound care, explore wound care in elderly populations, and then your second objective is something not related, to explore patient satisfaction with hospital care. They're not related objectives. This is in one area, this is another area. You have to create focus. The objectives help you, but you have to be focused on, you have to zero in on what question you want to answer. If one objective is about patient satisfaction with hospital care and the other one is about wound care, this is 2 different projects. Okay, these are 2 different projects, so you will not really gain much information, because now you're going in 2 different directions. 1 minute you're exploring patient satisfaction, and then the next minute you're exploring wound care. It will confuse your team, and it will probably not yield the results that you wanted. This is a common issue that people face in research, by the way. Why? Because when you start reading, all the ideas become interesting. Everything becomes interesting once you start reading in the area that you want to read about. So you'll say, oh, I want to explore this. Oh, I want to, this is so important. I don't know anything about this. I understand that reaction, but my recommendation is to be focused, especially if you want to publish later on. To publish, you have to have focus. No research, no peer-reviewed journal is going to say, oh yes, this is great project. They're looking for focus. If you are all over the place, it might make sense to you in your work context. And you might get excited and say, oh, I want to, the patient is frustrated and maybe patient satisfaction is relevant. Okay, you can talk about it in your literature review. You can talk about it maybe in discussion in the recommendations. If you are doing questionnaire, it might be an item in the questionnaire, but is it a whole objective on its own? Probably not. Clear? Do you have any questions so far? This is a very important slide. Okay. Let's move on to step number 4, choosing the approach. Okay, now I've said I'm interested in wound care. Of course, I'm only giving you an example here, but apply this to your work and the ideas that I'm sure you already have. I want to explore wound care, and I want to do it amongst diabetic patients who are in the age group 65 and above, for example. Diabetes type 1. I want to do it in the last 2 years. Okay, this is my question. Now I've identified the objective, and this is my question. How do I go about answering it. What tools do I have that help me answer this question or solve this issue? There are many ways and many tools in the toolkit that help you answer research questions. So first I'll ask you, what's your research question? Based on that, I'll make recommendations about what tools to use. What's the mistake people make here? The mistake people make is they say, oh, Doctora, I want to do a questionnaire. This is the first thing, the idea. They start with the methodology. So and then I say, a questionnaire regarding what? And they say, I don't know, what ideas do you have? What diseases? No, doesn't work this way. Oh, I want to do interviews. No. Tell me what the research question is, and based on the research question, we decide what the tool or the methodology is going to be. Okay, not the opposite. This is a very common mistake in research. People come and they say, I want to do a questionnaire. I want to do survey. I want to do interview. I want to do focus group. But when you ask them, what's the research question? They have not thought of it yet. So don't fall victim to this mistake. Start with the topic in the same way I've explained just now. Identify your objectives, and on that basis, we can make a decision about what methodology to use. You understand? مو العكس ما نقول أبغى أسوي استبانة. No. What's your work context? What's your area? What's your domain? What's your interest? From the work context, decide, oh, okay, we have an issue here. We have an issue, for example, in infection control. Why? Let me go read. Open the database, search in PubMed. Oh, okay. Infection control, there's certain bacteria that we need to be considering. There's resistance of antibiotics. Okay. The idea is getting more refined. And then I determine what my objectives are. I want to study antibiotic resistance amongst patients who post-surgery in cholecystectomies, for example. You see, now it's getting more refined. Once you decide what the question is, what the objective is, then you choose the methodology. So for example, let's go back to our wound care. I want to explore what in wound care. I'm wondering why the patients keep coming back with the same sores. Although we clean the wound, we give the antibiotics, I'm not understanding why. So my idea is maybe the patient is not able to take care of the wound at home or to prevent the wound from becoming prevention, the prevention that they do at home. So what do you do here to explore this idea? I would probably, if I'm really convinced that maybe it's wound care at home, I'll probably ask the patient. I'll come up with a questionnaire and I'll say, what do you know about wound care? And I'll put some items. If the wound is, for example, bleeding, you will do which of the following? Clean and bandage at home, go to the ER, and assess what my patient knows about wound care. Okay, I might say, no, I'm not interested in what the patient is doing at home. I'm interested actually in the numbers. So my question is, how often does the patient return to the hospital for the same wound? For example, where will you get the data? What will you do to answer this question? Write in the chat. Okay, so that's one way, Ghada. Ask ER doctors and nurses. Plastic OBD, okay. Nafisa, what do you mean from hospital? Explain more. I'll probably say, okay, so you're in this ward, I don't know, plastic ward. Please show me your files, patient files. I want to see all the elderly age group that is diabetic and has come to us for wound care. And then once I have this information, I will ask how many are returning patients with the same complaint. So now I have numbers. واضح? I have numbers now. Where did I get this information? Where did this information come from? From the files. Did I speak to the patient directly? Do I need questionnaire? No. Do I need to talk to the doctor? No. It's in the file. What do you call this type of study? No? Try again, Iman, not systematic review. Observational study, no? Because you're only observing. You come in and you observe and you see. You read the files and you make some calculations and you will have some numbers to help you make the decision. Okay? You see, so identifying the objectives and then determining how you will answer this question. The mistake that people make, I'm going to repeat it because it's a very common mistake. They say, I want to do observational study. I want to see the patient files for the diabetes. Okay, but what's the research question? What are you looking for? I'm going to give you the file. What are you looking for? You have to be very clear with this. اتفقنا على هذه النقطة؟ Are we all agreed? Topic, problem identification, refine topic by reading, identify objectives. Based on my objectives, I decide what methodology. I know we have not spoken about methodology yet. We will talk about it later and how to match it to the objective. But do you agree on the process? Okay. يعني I cannot go, I choose methodology and then go select the topic. ما يصلح. You have to go step by step. Okay. Now let's talk about number 5, exploring your topic. Now that I've decided that I will look at patient outcomes. So how many patients we have that have ulcers as a result, diabetic patients who have ulcers, how many are returning, how many have used antibiotics, and I can get all this information from the patient files. Okay, ممتاز. Now I go out and explore the topic by gathering the data. So getting the files, getting the information from the files, and collecting the data that I need based on the methodology that I decided. So here's a question. So let's say, for example, I've decided to use the patient files, records to come up with to answer meet my objectives. And is it okay to, if I see something interesting in one patient file, or to pick up the phone and call the patient and say, oh, I was reading your file and I noticed so and so, and I want to ask you some questions. Can you do this in research? No, you cannot do it. You cannot collect data, cannot gather data in a different way when you are in the field. You can only collect the data to meet your objectives and what was approved by you by the IRB. You cannot decide, oh, now I want to do interview. I saw something interesting in the file. I will ask this patient, where's the number? Let me see the number. No. You cannot do that. Okay, so you have to stick to your objectives. You will have some ideas, new ideas in practice. This is normal to have new ideas, different ideas. عادي إنه يصير كذا. Write them down and say, next time I should ask the patients. Let me design research project. I will write this in the recommendations, but you cannot do it in this research project. Okay. This is an important point because when you start doing research in the beginning, you say, oh, where are the ideas? I can't find ideas. Somebody help me. I need to have an idea. But when you start working in research, the ideas come up a lot. And the challenge when you're in the research project is to keep the focus. That's the main challenge, okay? So now you've explored your topic by gathering the data. What do you do with this data now that you have it? You have to analyze it. Okay, so it's not enough just to have, for example, questionnaire, and you ask your research participants to fill out the questionnaire. Now they filled it out. They used Google Form, for example. Now you have this data. 30% of your participants are female. 20% of them are working or retired, and so on and so forth. So you have to do some analysis. If we're talking about quantitative, you will begin with description. descriptive statistics. Like I've mentioned already, 20% of my participants are female, 30% are working, 70% are retired, 25% have diabetes complication. You describe this generally the picture of your population, okay? So this is very important. An important thing to do. And then once you do the descriptive statistics, this is very easy. You will probably do more complicated statistics called inferential statistics, okay? So this is to say like to find out if there's significant relationships between different things. So I want to know how many of my patients are returning to the clinic, and the relationship with wound complications, and the relationship of this to their adherence to medication, for example. So what am I going to do? I'm going to collect whether this patient is adherent to medication, what's their hemoglobin A1C, for example, and how many times do they return? Are they returning with the same issue, ulcer care? We have sophisticated machines, sophisticated programs like SPSS and RAS that help us make these calculations. They're mathematical equations. You put the data in, it tells you what the significance level is. So now I can say it's the relation, there's a significance between how adherent the patient is to medication and the number of times they return to the clinic with issues in wound care. Okay, so this is very, very important. The analysis is an important part of what you do in research. So I'm, of course, only giving you one example so that you can understand the general idea, but there are different ways to analyze the data based on what kind of data you collected. Once you have analyzed the data and you have now some ideas, you start writing a report about what you did. Okay, you start writing up an introduction. What did you read in the literature? What's your research objective? All the steps that we did, you write them in this fashion. What's your methodology? Well, I used a questionnaire. This is how I designed my questionnaire. And then you write up the results. 200 diabetic patients participated in this study. We analyzed the data in so and so fashion. We recommend, as a result of our outcomes, to increase patient education, to design a program to teach patients about wound care, to upskill staff who are taking care of diabetes patients, and so on and so forth. Based on your results, you make the recommendations. Okay, so this is super important to understand. What is the research project and the importance of scope of research? Is this clear? I will, of course, talk about this more deeply in the coming sessions, but generally, do you agree with me on what has been said? Okay, so just a note to keep in mind. Sometimes you will see other more experienced researchers. They have already a questionnaire that is validated, and the World Health Organization was involved in its design. They'll come with this questionnaire, and they will do the study based on the tool. And you will probably say, but Dr. Dudu told us not to do this. Start with the methodology, then go to the objectives. If you are an experienced researcher, sometimes you know what tools and what the literature says. So you can make decisions based on your wealthy experience as a researcher. So if you see this happening, it really is a reflection of their experience and wealth of knowledge. So they can make decisions based on tools. But for you as a beginner, I do not recommend it. So don't do it in that way. Actually start from step 1, as I mentioned, and work your way through. Okay, so let's see. Let's stop here, take a break. It's been an hour and a half. Let's do 10 minutes. Let's come back at 9:40. And we will continue with our program. Okay. So this is where we left off. You analyze the data depending on what type of data you have, quantitative or qualitative, and so on. And then you write up the report. Okay. It's essential that you follow these steps in the order that I've shared here, and ensure that you are focused and that you are answering the objectives you set out. Okay. Let's now talk about the qualities of a good topic. In the previous, before the break, we talked about choosing something that is relevant to you. You can't do research in pediatrics and you're an adult physician. You can't do something to do with molars and you are a pharmacist who has no relationship to dental care at all. You have to be focused and aligned with what you do in your work context, okay? This is very important. But beyond that, there are a few things to consider. One, the institute where you work has certain needs, okay? So ensure that you are, through your research, meeting institutional objectives. So it's not enough for you to do a research project that is relevant to you or something that you like to do. Sometimes certain projects, they are not relevant to the institute where you work. They might be more interested, for example, in quality assurance. Okay. Writing or exploring topics that are relevant to what the Institute needs and wants is essential. Sometimes you might have an interest in, for example, patient experience, but this is not something your institute needs. So, for example, you work in the research center, not necessarily relevant to what the institute needs. So it's important to, if you're just starting out in research, to visit the research center or research unit in your hospital, in your institute, and to ask them what kind of projects are needed in the institute, what kind of goals are we trying to meet. This is very important. Okay, so that's an essential consideration. Second, it should fit within the available resources. Okay, so yes, your idea might be great, it might be aligned, it might serve the institute, but do we have the resources to conduct this research project? Very important. So, for example, you might want to do an experimental study design, and you're considering maybe buying a certain medication and doing a clinical trial. Okay, first of all, can the institute afford this clinical trial? Because it's costly. It costs a lot of money to do something like this. Do you have available resources? Let's say you're designing a patient course and you want to do pre and post. Do you have the space to do this? Do you have the resources? For example, you want to do it online. Do you have Zoom? Do you have the appropriate tools to do this course? Very crucial point. Sometimes we have good ideas. They're relevant to us. They are relevant to the institute, but the resources are not available. I might say, I want to do the same example, wound care in diabetic patients. Okay, but the patient files in this primary care clinic, they're not well documented, the patient visits. So the information that I need isn't available. Okay, so there are files, but it's not documented very well. The idea that I have is good. It's a good idea. It's a relevant idea. I need to answer this question, but I don't have access to the data. Okay, so this is super, super important to consider at this time. The idea is good, yes. Is it aligned? Yes. Is it relevant? Yes. But is the resource available? No, I cannot find this information in the file. So then what? You have to be flexible. So before you embark on study research projects, have a conversation with people who do research in your institute and ask, could I find this? Is it easy to find this information in the file? Is it easy to gain access to the patient so I can do interview? Very important. Very, very important. Okay. A third consideration for a good topic is it should enable you access to data easily. Okay. sometimes certain data is not easily accessible. So for example, if you're asking sensitive questions about elderly population, you're probably going to ask who takes care of the wound? Is someone at home helping you? This is sensitive information and private information. Is the patient going to answer the question honestly? Are they going to give you the correct information? So they will not say to you, oh, my son, my daughter is not helping me with wound care. I have to do it myself, although they are elderly and they need help. So the information is not always easy to access. So you have to design your project accordingly. Very, very important to keep that in mind. Okay. Also, one of the qualities of a good topic is choosing an area that has not been researched. Okay, so research topics, when you start reading in the literature, you will notice that maybe there's 5,000, 6,000 articles only on wound care in diabetic patients. But in actuality, this has been done in small scale. So you decide to do it on a multi-institute level. You might decide to do a national study, okay? So this is important to keep in mind. How much research is on my topic, and has someone already addressed it, and do I need to address it? You should always look to be original in the way you do a study project. Okay? Sometimes we ask questions that are good questions, but it's not easy to answer them, okay? So being manageable in your choices is an important factor for your success. This is very, very essential for anyone to at least reach the publication stage. Very, very important to consider. Is this research problem manageable? Can I gain solutions? So for example, you might say, oh, I want to know how to cure cancer. There's a lot of research projects that are done on cancer. There's a lot of work. There are many types of cancer. There's stages. Are you asking a manageable question? Can you find solutions to your research problem? No, it's unfocused. That's why. Very broad. You have to really focus and come closer to the a certain area. Okay. So important to make sure that your research topic is manageable. And this is one of the mistakes we see in research oftentimes is people ask really nice questions, but these questions are not easily answered. Okay. Is this slide clear? The qualities of a good topic? Okay. Let's talk about identifying a research topic a little more deeply. الحين احنا تكلمنا بشكل عام ومجمل. We took an overview of what the research project is. Now we're going to dive deeply in each of the ideas I mentioned. Identification of research topics. It can be from your area of interest in your work context. It can be from the literature review. So you might say, you know what, I don't have an idea. I work in patient safety. I know that this is my work, but I'm not sure what. I'm not getting an idea from my work. Start reading articles on patient safety. They give you ideas within the research project. So the literature review is important. Another area to consider is theories. So sometimes we have certain theories about how people do or go about the way they think about certain um, uh, behaviors, patient behaviors, and the way patients make decisions. So I decide from that theory, I can launch my research project. So, for example, we have theories regarding the behaviors of patients and why patients, for example, take certain medications and adhere to the medication. Sometimes they don't. So I can use that theory to see how my patients behave in regards to their treatment. So that's one way to do it. Sometimes it's important, not sometimes, actually all the time. It's important to brainstorm with ideas with others. And also it is important to discuss with colleagues. Someone who has more experience than you can generally give you sound advice about what areas to really focus on. And this is, I cannot emphasize this point enough. Of course, you're going to read. Of course, you're going to depend on your work context. But if you know of someone who does a lot of studies on diabetes or patient safety or whatever the area might be, it's important to speak with them first, to say, hey, I have an idea. I was reading in the literature about patient safety and the best ways to go about patient safety. What do you think of this idea that I've been having? They are the best person probably to say, this is a good idea. Actually, maybe if you change this and this, you will have a better luck. It's not manageable to do it in this way. How about you consider a different way of doing it? Okay, so where do we find people who have similar interests in research? We are very fortunate nowadays to have different research focus groups, medical societies, registries. So for example, the Diabetes Center, they do a lot of research. So if you wanted to do, for example, diabetes, you reach out to them and see what they can offer you in terms of advice in your research project. Okay. So there are many sources for research topics. For me, doing something that is from your work context helps you kind of enhance your work. So that's the area where I usually recommend people go. After that, reading in the literature refines your idea a little bit more and it might give you a better idea. Brainstorming is essential to our growth as scholars. So engage in that activity even more. Discussing with colleagues really hones in on what is important at the current time. So it might even give you access to data and might give you access to information that you didn't know prior. So discussions with colleagues is essential. My advice to you is not to discuss your research ideas with people who don't have the right experience. مو كل أحد نقدر نناقش معاه أفكارنا البحثية، لازم يكون شخص صاحب خبرة. And they have a background in research and in the research area that I'm interested in. So if you discuss with people who are not experienced or people who are not experienced in this specific area, they might not give you the best advice, okay? So it's important to discuss with the correct people, the right people. Not everyone can help you in the way you desire. Okay. Another way of coming up with good research ideas is seeking a professional. So beyond your colleagues والناس اللي بتشتغل معاهم والناس اللي going to entities that are professional entities. Nowadays, we have the Saudi National Institute for Healthcare Research, the Saudi NIH. We have RDIA, هيئة تنمية الأبحاث والابتكار. These are two entities that their core business is research. So they can point you in the right direction, include you in research groups, tell you what the priorities are, give you access to information or resources like grants. So it's important beyond the experts in the subject matter. It's important to be aware what professional entities exist for research and how they can help you. There's مثلا King Salman Center for Disability Research, so highly specialized in disability research. And it's very important to recognize that there are entities that their daily business is to engage with professionals, to engage in research. So it's important to be in contact with them. There's an important consideration in the daily problems that we face in context, especially for those of us practicing directly with patients. One easy way to get into research is through reporting cases. So for example, if you see a unique case or different case, it's very easy to write a description of what you saw and to write that up and submit that to, and there are specialized journals for case reports. This is essential to our growth as a community, and it's a simple way to include your efforts in publication form. Okay. One recommendation I have, and I certainly benefited from it, and you might as well. If you keep observations in a notebook, so for example, if you see things in your practice, you just keep notes, different notes. In time, you'll notice there are themes that come up constantly in your notes, and that might be a source of ideas for you in the future. بمعنى, on a daily basis, you might not notice wound care, but you might, if you are taking notes, you'll notice that it comes up a lot in your entries. So then it becomes a theme and you say, oh, this looks like an important thing that's happening in practice. How can I explore this idea further? You might not be practicing in the clinic or in the OR and one-on-one patient care, but you might be interested in what happens on the organizational level or the community level. Okay, so essentially we're talking about public health. You might be interested in health promotion, environmental health, the way preventive medicine, what happens before we come into before the patient comes sick and comes into the hospital. What happens in their daily life? This is a very wealthy area to do research in. especially now against the backdrop of the health transformation program. There's a big emphasis on preventive medicine and public health. So it's essential kind of to be aware of that and to again, this really depends on your interest. So if you are interested in one-to-one care, and that's relevant to you, you can focus there. But please note that on a larger scale, you might be talking about the community. So for example, you're talking about diabetes. Diabetes doesn't occur in the clinic. It occurs way before the clinic. So the way people eat, for example, their dietary habits, their exercise habits. So you might say, I don't want to focus on wound care. I wanted to address the disease before it happens. So then the whole scope of your research changes. And you might go into conducting studies in, for example, school settings and seeing if the way students eat influences the chances of them getting diabetes, and so on and so forth, you see? So these are all sources of determining your research topic. You don't have to limit yourself, but you have to ensure that you are aligned with the type of work you do and the resources available to you. So now let me just summarize what we have said in the past couple of slides, because it's important. Beyond knowing your work context and what is your specialty and your area of interest, there are things to consider. Consulting colleagues, beyond colleagues, professional entities, مثل ما قلنا Saudi NIH, RDIA, research centers within your institutes, for example, KMARC, in National Guard, and so on and so forth. They will provide the support that you need and the direction that you need. Okay? Another important lens we talked about in these two slides. It's not all one-to-one patient care. Healthcare research is beyond that. It can be about the community. It can be, the studies can be done beyond the hospital. مو كل شيء نسويه لازم يكون patient file. You can collect data from websites that provide, like the World Bank, for example. They provide information on health indicators by country, but you can compare Saudi versus other countries in certain diseases and certain vaccinations, for example. So this is very, very important to keep in mind, okay? Is there any questions so far? Or comment? Have you heard of the institutes that I mentioned, the Saudi NIH? Okay. Google the Saudi NIH and the RDIA. You will come across their website. And you will see the important things they are doing in terms of research. As a beginner researcher, you have to be aware of them. I guess they are open to Saudis and non-Saudis. The important thing is to have a sound project that is relevant. Okay. Let's now move on to research objectives. I've mentioned this briefly in our overview, and I've mentioned that they need to be SMART objectives, okay? Why is it important to have an objective? They help us be organized and to reach our goals. Without having clear objectives, it is very difficult for us to reach the solution to the problem we are proposing, okay? So objectives are an essential component of any research project. If you don't have objectives, you don't have a research project, okay? How can you investigate a problem if you don't know what the problem is, how you're going to investigate it, at what time, what's the time frame? Okay, so that's why objectives are very essential to your success in any project, especially research project. Research objectives, they give us, they point us in the right direction. Most times when someone is appraising your research, they will first look to your objective. Is it clear the way you've written it? Do you have a clear idea of what you're going to do? This is essential. I've seen several research projects. The goals are all over. They are not clear. They're not related to each other. So if you have a clear objective, that is a reflection of how successful your research project is going to be. Okay. It guides you to your goal. Yes, I agree with you, Vanessa. Also, you have to understand that you are writing the research. Someone's going to read the research. Important question. Can someone replicate your study project? Can they do it again? It depends. Are the objectives clear or not? If they are, the study can be replicable. If it's not, it'll be very difficult to come to scientific findings that make sense and that can be replicated by others. Okay. What is a research objective? It's a statement. Okay. It's a statement about one sentence. Okay. It is clear, it's concise, it provides direction to investigate the variables of the study project. Okay. You would have maybe two to four objectives in each, depending on the size of the project. But the important thing is to have it make sense and to be clear and to be not too long. So it's only a statement, not a whole paragraph. Okay. In this research objective, you have to describe what the research project is going to do. Is it going to describe, explore, analyze? What's the verb that you will be, action verb that you will be using? As I mentioned earlier, we use SMART, which this is an acronym. SMART is an acronym. Each letter stands for something. Okay, so what do they stand for? Your objective has to be specific. There's a difference between saying, I'm going to explore wound care and saying, I'm going to explore wound care amongst diabetic elderly population. Specific, huh? So now I moved from, are you talking about wound care for bedridden patients? Are you talking about wound care for pediatrics? Are you talking about immunocompromised patients? What are you talking about? So you have to be very specific. Otherwise, you will be performing research that is unspecific, and you will have too much data. And by the end of it, we don't know what are you trying to do. Okay, so very important is to be specific. So that's the first letter. Second letter is measurable. Whatever objective you decide on, you have to make sure that I can measure it. The third characteristic is to be achievable. Is what you are setting out to do a reasonable goal? So for example, usually research projects last 1 year. يعني the maximum 1 year, 1.5 years. If you say, I want to explore wound care for patients who are elderly and diabetic in the previous 30 years, you will probably get thousands and thousands of patient records. Okay, is that manageable? Even if you have a team, do you think it will be manageable? No, because even if you have a research team, going through thousands of files, especially files that are old, records that are old, it's not easy to do. Okay, so a more reasonable way is to say, okay, I'm going to determine my time frame. So I'm going to look at patient records in the past 5 years. Now the time frame has shortened quite a bit. Okay, so it's more manageable for you. So instead of thousands and thousands of records, now you have maybe 1,000, 2,000 something, or 500 files, something manageable that you and your team can do. And when you say, okay, I have 500, I have 1 year to do this project, we can gather the data and analyze it within 6 months. Okay, so that's another characteristics for a good objective. R stands for relevant. Your objective has to be relevant to your research project. So as I mentioned earlier, you cannot talk about patient safety when the project is about wound care. Okay, so ensure that you are relevant to the long-term objectives of your research project and your institute. Final one is T, time-based. And this is very important to keep in mind. You have to be realistic with your goals, okay? The thing that happens with research oftentimes is we get too ambitious and we think we can do a lot of things. But in actuality, because you have a busy schedule, you're working and doing this research project on the side, it's important to be realistic. Okay, very important to be realistic and to clarify the tasks and how long it's going to take. So for example, I know in my institute, The IRB takes 2 months, for example. So I have to put this in my schedule. I know that sometimes it's not easy to get to the data. So I'm going to put 5 months and make sure I accomplish this goal within the 5 months. Okay. The more you are able to accomplish these goals, your motivation increases. Okay, so the motivation for doing this research project increases. One of the challenges faced in research oftentimes is we are not able to determine how long it will take to do one task or the other. So we think it will take 1 month to collect the data when actually it will take 3 or 4 months because it's not easy to access the data and so on. So we can't get this task done within 1 month. We get frustrated. Okay, you become very frustrated and you are unable to achieve the goal. And more often than not, research projects are discontinued because of this unclarity in terms of objectives. Okay, so it's very important to abide by this acronym SMART. You have to be specific with your goal. You have to ensure that it's measurable. You have to ensure that it's achievable, relevant, and time-based. If you can abide by these characteristics, you will have a very good statement objective, okay? Do you have any questions so far? Okay, so Abdurrahman in the chat writes, I'm a dentist and sometimes we have a very rare syndrome, but without dental treatment or any intervention. Can we write a case report on the syndrome and the patient without any dental treatment? Yes, you can. The idea of case reports is to describe what you see in the clinic. بغض النظر كان فيه مرحلة علاجية أو مو كل diseases are treated. Okay, but it's important to make sure that there's relevance to your field, Dr. So what kind of rare syndrome are we talking about? How does it influence dental care? This is important to describe in the paper, but it doesn't mean you have to have an intervention at all. Are there any questions on the SMART acronym? Okay. When you're formulating your objectives, sometimes remember, it's a short statement, it's not a long statement. So sometimes we put unnecessary accumulation of information that is not needed. Something that you can write in the literature review when you're discussing in the introduction, but does not need to be in the objective. So of course, this means that you will be writing the objectives, maybe first draft, and then refining it as you move along. Okay, so refining your statement, very essential to your development. يعني مو أكتبها مرة واحدة وأقول خلاص هذه هي objectives. Actually, no, you refine it and you revisit and you read and you change it a little bit and you get some feedback from colleagues and you change a little. The important thing is to make sure it's short. No unnecessary information should be included. Okay, so here we give an example. Sometimes you're interested in identifying certain variables, while others are not relevant to your study project. You read about them in the articles, but they're not relevant to you. So what do you do in this case? You avoid unwanted information. So for example, there's we're talking about wound care, and based on that, in the patient files, we noticed that patients are, for example, male. More often, they're male than female. This might not be relevant to your objective, so why collect that data or include it? Also, you cannot change the objectives after you have gained IRB approval. So we might see interesting information while we're reading the patient records, but they're not relevant to us, so we don't include them. Okay. Another important benefit to writing objectives is organizing the study into phases or parts. Okay, so this is important to recognize. Once you formulate the objectives, you'll notice they feed into each other. So, for example, you start with describe wound care in the primary care clinic in the period between 2022 to 2024. Okay, so this is my SMART objective. The second one would be to say, explore challenges with wound care amongst health practitioners in the primary care clinic between 2022 and 2024. You see, one feeds into the other. So في البداية أنا وصفت generally what wound care looks like in the primary care clinic. Second, I honed in on the challenges that are faced amongst health practitioners. So this helps me break up the project into smaller pieces that are more manageable. Okay. This is again reflected in the results section. So whatever however I defined my objectives to begin with and the phases of this study, لما أجي أكتب results section, I will write it in reflection of my research objectives. So I spoke about the first one, describing wound care in the primary care clinic. My first section in the results category would be to describe that objective. I wouldn't start with, for example, the health practitioners, which is objective 2. لا أمشي بالترتيب. Okay, so organization is essential. Objectives help us in this area. If you formulate your objective in the right way, it will facilitate the development of the research methodology and help orient you to the collection, analysis, interpretation, and utilization of data. It gives you direction, so you know where you are going. If you don't do that, whatever information you read in the field, it will seem interesting and you will want to put it in the study. But unclear objectives will oftentimes be, if they're too broad, you'll oftentimes say, well, okay, this is relevant information. It's related to my objective. But the more specific your objective is, the better direction you have. Okay? With me so far? Do you agree or disagree? Have you worked on objectives before? What was your experience? Was it easy to do or difficult? Okay. Why was it difficult, Nafisa? What's the difficulty? Yes. Yeah, that really highlights a very important point that actually probably the first objectives you write for in your first research project, it's not going to be the best research project. It's not going to be the best. So you have to really keep practicing research. Only in time and in practice does it get better. So if you do one research project every, I don't know, 4 or 5 years, and you write objectives just once, your objectives may be okay, but they will not be great because you're not practicing. So this is the takeaway message for objectives today. Let's talk about the types of research objectives. You will have general research objectives, and you will have specific objectives. General research objectives, and then you'll have more specific, specialized research objectives. Okay, sometimes we call them aims versus objectives. Sometimes we call them outcomes. But generally, a general objective is a broad goal. Okay, so you say the general objective of the study is to study wound care amongst elderly population in the primary care clinics. So this is a general study. But more specifically, you'd say what I've already mentioned. Exploring or describing how patients, for example, understand or define wound care. Explore patient understanding of home care for wounds and ulcers. These are more specific goals. So in your research project, you might have general objectives and specific objectives, but my recommendation for you, this is just for you to know, my recommendation for you is to have a broad aim. So if I ask you, what's your research about? You say, it's about wound care amongst elderly diabetics, okay? But if I ask you, what are you specifically trying to achieve? You say, I want to explore patient understanding of wound care in elderly patients who are diabetic in the year 2000 to the year 2020, 2004, for example. This is an objective. Explore health practitioners' views and experiences. This is another one regarding wound care in the primary care setting. Explore challenges. So this is essential to bear in mind. So if I ask you quickly, what's your research project about? You should broadly tell me what it is. And then you should have 3 to 4 objectives. Very narrow in focus. So make sure your objectives are specific. I have repeated this point several times in the past half hour. It's to underline and underscore the importance of being specific. One of the more common mistakes that we see in research is having research objectives that are far removed or too broad or not very clear. So start with a general objective or aim and break it into more logically connected parts to form specific objectives that can be achieved in phases, okay? So every time you meet a specific objective, you're ultimately meeting your broad goal, okay? And if I read your project on my own, I should be able to execute it. Okay, so this is very, very important. Always ask yourself, if someone were to read my work, can they do what I did? This makes it very easy for you, actually. Can someone do what I did from my objectives? Can they replicate it? If yes, then your objectives are good. If no, then that means you have to visit them again and try to update them, okay? Nafisa is saying, I'm thinking of cause of depression in students, especially medical students. How can I proceed? Okay, so Nafisa, you're in step 1, which is broad topic. Are you teaching in a medical school? Is this relevant to your work environment? You can answer in the chat. Okay, so do you have access to data easily? If you work in a medical school, you probably have access to the medical students. So you can study the medical students directly. But if you do not work in a medical school, maybe you work in a hospital setting and psychiatric clinics, you will have to collaborate with someone in a medical school to access the medical students. Okay, so that's an important consideration. You have a broad area. Now, my advice to you is to hop onto the database and search depression amongst medical students and see what's out there in terms of studies. Don't rush. Keep the idea. Remind me when we talk about the databases, we will go on PubMed together and we will research, okay? Just remind me, Nafisa, so we can do step 2 with you. Okay, so let's see an example. This is a general objective. A quasi-experimental study, this is a quasi-experimental is a type of study, okay, methodology, on the effects of poverty on education amongst selected cities in India. Okay, so this is a general idea. Do we understand what the research study is about? Generally, yes. But can we replicate the study? Not yet. So you have to give me your specific objectives. So my specific objective is to assess the effects of poverty on education among uh, age groups 10 to 12. Now I'm being specific. To determine the prevalence of poverty among students in grade 5 to grade 7 in Riyadh, Saudi Arabia, in the north of Riyadh region, district, for example. See more specific. فأقدر أحدد بشكل دقيق and I make my project more manageable. Another example of a specific objective is to compare the severity of morning sickness among um, um, pregnant women, for example. Okay. Let me give one more example. To identify the relationship of poverty with age or other selected demographic variables. So this is very important. I want to know the relationship between poverty and age. Does it increase with age? Does it decrease with age? And so on and so forth. Other demographic variables could be gender, they could be educational level. So you see how it's specific. In the first one, I didn't mention any of this. I just said I want to do a quasi-experimental study on the effects of education and poverty. But when I'm talking about specific objectives, they have to be manageable. Okay, to state an objective, it should be brief and concise. It should cover the different aspects of the problem and the contributing factors. It has to be coherent and logical. So there needs to be a sequence to the way you write objectives. You need to have operational terms, which is actionable verbs. Saying things like describe, explore, illustrate, analyze, specific verb. Okay, so you can't say, for example, to understand. That's not appropriate to say to understand. Because what does that mean exactly? So you need to use action verbs. And you have to ensure that the objectives are realistic. Okay, so that's very important as well to kind of consider what local factors play a role in the way we are trying to achieve this objective. You have to have the ability to evaluate as well your research project, your specific objective. So how will you say that I met, yes, I've met this objective, no, I have not met this objective? the action verbs, they help you do that. So the more poignant your action verb is, you are better able to evaluate what you have done, okay? Let's take some examples for these verbs. So you don't have to, you can find these readily online, and they're in the slides here. It depends if you're doing the knowledge domain, for example, you can say to count the number of patients who are returning for wound care. This is very specific. I know what I want. To define wound care according to health practitioners. So I'm going to ask health practitioners, what's wound care? What does wound care mean to you? And see what they answer. Is this manageable? Is it specific? Can I evaluate this? Yes. Other verbs that you can use: identify, label, name, outline, read, recite. So these are some of the examples that can be used when you're talking about the knowledge domain. If you say, no, I'm actually thinking of the application domain, okay? So the action that I'm trying to achieve is practical. You would use different verbs. So you will say examine, prepare, for example, classify, modify, solve. So these are some of the verbs that you will use. Generally, if you're doing an observational study, you will stick to these verbs here in the knowledge domain. Application, usually, this is for more experimental study designs, okay, to calculate and compute. And there's also verbs specific to comprehension, and this is usually the kind of verbs we recommend for a qualitative qualitative research design. So we'll say discuss, explain, distinguish. These are very important verbs for qualitative research design, okay? Another important area, or domain rather, is the analysis domain, okay? And these are the verbs we kind of use in reviews, literature reviews, in all types: systematic, narrative, scoping reviews. You will probably use these verbs: analyze, develop, differentiate, outline, because you will be doing critical analysis in this area. So these kinds of verbs will help you in that research design. Another important domain is the synthesis domain. So when you're doing literature review or any of its type, narrative, systematic, you might be using verbs such as categorize, compose, combine, organize. These are important verbs that will help you in putting together your objectives, okay? Now, these are relevant to reviews, but does not mean I can't write them when I'm doing observational study, when I'm doing cohort study, or it really depends on what the objective is. You have access to all these verbs and see what fits best to your objective, okay? Another important domain is the evaluation domain. So appraise, contrast, measure, critique, compare. These are important verbs to use when you're evaluating something. And I'm sure you've seen this before in either previous projects that you've worked on or programs that you've designed. These verbs help you come closer to the goals you're trying to achieve. And as I've said, they are available to you no matter what the objective is. It's best to choose according to your need. Okay, so what's the takeaway message here? We've been talking about objectives for the past hour. The research process is an ongoing process of planning, searching, discovery, reflection, synthesis, revision, and learning. It's ongoing. So ما توقف مسألة البحث العلمي. You don't stop the process. It's ongoing. So this is very important to bear in mind. Objectives help you to plan better and ensure that you stay on track, that you don't, for example, forget one area or so the better the design, the better the process, the better the delivery of the outcomes. Okay. And never forget that there's always a process of reflection and revision. So to say we should have done this in this research project, but we didn't because of time or resources, but we should be doing it in the next one. Okay, so this is ongoing, and research projects feed into one another. Okay, let's see, what's the time? Okay, this would be a good time to take another break. Let's do 10 minutes. So we'll be back at 11 to talk about step 2. Okay, so we'll be back at 11. right? So we essentially are finished with step one, which is Intro to Health Research. We have gone through the steps of the research project. We spoke about focus in research, which is an essential component. We also spoke about objectives and objective writing and the difference between a general aim and specific objectives. The characteristics of a SMART objective is also the characteristics of an objective are also an essential component using SMART, specific, measurable, achievable, relevant, and time-bound. So if you manage to meet these characteristics and requirements, you will have a sound start to your research project. So that's step one. Step two, we are going to delve more deeply into research design and methodology for the next hour, and probably after the prayer lunch break, inshallah, we will continue to talk about this step. Okay. Generally, you have two types of research methodology. You have quantitative research and you have qualitative research. If you put them together, they are what we call mixed methodology. Okay. Let's talk first about quantitative research. It's a type of research that explores anything, any phenomenon or idea through numbers and measurements. Prevalence, incidence, descriptive statistics, inferential statistics, significance level. These are all statistical methods that are commonly used in research. Generally and broadly, we call them quantitative research. So anything you see with numbers, this is quantitative. Bar charts, plot graphs, these are all called quantitative research, okay? What's the general idea in quantitative research? The general idea is we can quantify anything and answer research questions with numbers. So for example, if I have a large number of patients who have issues with wound care, that means I proved that there's an issue with the way I'm providing care to ulcers in diabetic patients, for example. Okay, so this is called positivism. Positivism is a way of thinking, and it says you can look objectively to anything. So as long as you can collect data in the form of numbers, you can answer soundly and objectively, okay? So keep that in mind. What are the key elements for positivism? People who subscribe to this school of thought, they believe that there is a truth, an objective truth, and you can prove it by numbers. And it always exists, okay? And if you do enough research, you can discover this truth. And you can prove, for example, there is a relationship between wound care and age of the patient, for example. People who subscribe to this school of thought believe in quantification. So if you want to speak with them and have a discussion, you have to have numbers, the prevalence of the disease, the incidence of the disease, and so on and so forth. People who subscribe to this school of thought are independent from what is being researched. So the researcher here believes that they are not influencing the research project and that the research project is objective. Is this true? Can you be independent of the research project? Go ahead, write in the chat. Can you be independent of the research project as a researcher? It's up to you to think about it, but for me personally, let me share my point of view. You can never really be independent. تصير objective 100%. You can be biased. Choosing the topic we chose, that shows bias. That you think wound care is important, or you think diabetic patients are important. Why didn't you choose multiple sclerosis, for example, patients, hyperplasia patients? This in itself is considered a form of bias. So we're never fully independent from what we are researching. There's some degree of bias, but what we can do is try to minimize the bias in research, okay? This is important. The thing is, in positivism as a school of thought, they don't believe that you are biased in any way. They believe that you are independent. So it's just something to keep in mind. How do they think in positivism? They use deductive reasoning. So 1 + 1 = 2. If I can see sine x, that means sine x exists. Okay, so this is important to consider. Deductive reasoning. This will make more sense when I explain qualitative research. So whatever the case may be, positivism is always aligned with quantitative methodologies, so the use of numbers. Let's compare it to qualitative research. Okay, so qualitative research is a type of research where you describe phenomena or ideas in words, not numbers. So the opposite of quantitative. Quantitative, from the name, it deals with numbers. Qualitative deals with words, quotes, usually through interviews and focus groups. Okay? So this is important to keep in mind. Okay? Can you use statistics to analyze qualitative data? No, you cannot. Usually, لا. We use different methodologies. So we use thematic analysis, narrative analysis, framework analysis. These are different ways of doing analysis. It has nothing to do with SPSS or those programs that we are used to hearing about, okay? So generally, we will take quotes from, I will conduct an interview, and based on the interview, I will record, of course, and then generate transcripts of the recording and sit with my highlighter or my PDF and highlighter and read through the interviews and decide what is relevant and what kind of themes come up in the research. Okay. As opposed to positivism, where we are using deductive analysis, so 1 + 1 = 2. In qualitative research, we're using something called interpretivism. And this is a way of saying, I'm not going to impose my ideas. I'm just going to ask the participant, what is wound care like for you? Describe it for me. And I allow the participant in their own words to describe their experience. Okay, so this is very important. And when I use this, I kind of go from narrow to broad. And the opposite is true for quantitative studies. You go from broad to narrow. Okay. Again, in qualitative research, we're using words. We're not using numbers, and the opposite is true for qualitative. We're not using words or quotes, we're using numbers. Do you have any questions so far? I know that these 2 slides are heavy and maybe has new information, but it helps you understand where research comes from. Okay. Let's talk more deeply about the elements of interpretism. Individuals in this paradigm construct their own realities, okay? So in this, we don't believe that there's an objective world and numbers are the key determining factors of our decision. Actually, no, we believe, if we use this paradigm, that everything is socially constructed. And it's up to the individual to describe what they are experiencing in the reality, okay? So we don't make any preconceived judgments. Let me give you an example so that you can understand better. Say, for example, you want to explore wound care in the determined population, elderly patients who are diabetic. Okay, if you wanted to do a quantitative methodology, you would say, I'm going to collect data on how many patients are returning, and I will use the number to make a recommendation. So if more than 70% of my patients are returning with infections and unhealed wounds, that means my health practitioners are not providing the right care, or that my patients are not do not know how to take care of their wound at home. Okay, so these are deductions that I'm making. Okay, I'm using deductive analysis to explain what's happening and the numbers. Okay, but interpretivism and qualitative methodology helps me explore more deeply. So if I see more than 70% of my patients are returning, I'll say, why? Why? Is it the patient? Is it the clinic? Is it the medication? What is it? So I decide, you know what? I'm not going to depend on the numbers. I'm going to ask my patients. I will do a qualitative study and I will conduct interviews. And I will ask, what's it like to take care of a wound? What happens to you when you have a wound? How do you find out about it? How do you take care of it? Tell me about your experience. And you allow the participant to describe the social reality as they see it. Okay? Some patients might think that it's not their job to take care of the wound, that if something happens, they need to come to the ER. This is the way they understand wound care. And maybe it will require deeper exploration. Okay? Do you have any questions so far? Okay. This table summarizes quantitative versus qualitative approaches. Okay. As I've mentioned earlier, you are dealing with numbers. In qualitative, you're dealing with words and narrative. In quantitative, it's concrete and conceptual. You can test and retest. In qualitative, no, it's more contextual, so you gain a broader, a deep understanding of the experience of the patient, which is important information. You can do experimental in quantitative. So you ask questions like, how much, how many? You can take a random sample. Qualitative research, you can repeat the interview. So you ask questions like why, who, when. It doesn't have to be a random sample. You can choose specific purposeful sampling, so specific cases. You use statistics to analyze in quantitative data. So the programs that we are used to are SPSS and RAS. In qualitative data, to analyze it, you use an interpretive approach. There are programs such as Atlas TI. This is one of the programs. You can feed the transcripts of your interviews into it, and you can go over it within the program and highlight and determine what themes are important in your research. Okay. As I mentioned, in quantitative research methodology, it's believed that the researcher is separate from what they're researching. Whereas in qualitative research, you are interacting. When you're having an interview or a focus group, you're talking to your participant. So you will influence the way they approach their answer the questions that you are posing to them. One of the benefits of doing qualitative research is you can study several things at one time because you're talking to the patient or the participant rather. You can explore the ideas with them more deeply. So it allows you to, if they say something, for example, about infections or about medications, you are allowed to explore it. This is called interpretive paradigms. Whereas in quantitative research methodologies, you can't do that. خلاص أنا حددت objectives معينة, I cannot go beyond them. Okay? So this is one of the benefits of doing qualitative research. Okay, now broadly, we have addressed the difference between quantitative and qualitative research methodology. We're going to dive deeply into the types of research that can be done. Okay, so how do you classify it, and what are the different types? Okay, so this is a very nice diagram that helps you organize the way you think about research. So research can be descriptive, and it can be analytical. Okay, so in one area, you're simply describing what you see. In another area, you're analyzing what you see, okay? The description can be cross-sectional. So you do a survey, for example, or you use patient files. You're just observing what you see. You find the data as is, one snapshot in time. Qualitative studies are also considered descriptive when you do interviews or focus groups. So this is one area you're only describing. There's another branch, analytical studies. So analytical studies can be experimental. These are clinical trials. I'm sure you've read about them. This is when you are experimenting. So you give the participant medication or some sort of intervention and see what's the result. So you are actually doing something to the patient. It's not just observation. Here in description, we're not doing anything to the patient. We are just taking information at one point in time. Thus, I'm not giving them intervention. I'm not. So this is an important distinction. The other branches, observational but also analytical studies. So I'm not giving anything to the patient, but I'm trying to find relationships between things. One type is cohort study. Another type is case control study. So these are very important study methodologies that we will dive deeply into in a minute. How do you characterize studies? One, on the basis of the nature of the information we're trying to gather, so qualitative and quantitative. So, as I've mentioned already, if it's numbers, you're looking at quantitative. If it's words, it's qualitative. It can be on the basis of utility of content. Okay, so sometimes we do theoretical research, okay, basic and fundamental, and sometimes we do experimental, so or applied research. So we take action and we measure that action. Okay, so this is another way to categorize research. Also, research can be classified according to being in terms of time. So sometimes I take just a snapshot. So I go in and I see the patient records and I decide I want the information in this year. That's it. And I report it. Or I have a questionnaire. I collect data. And based on the data I collected, I report my study findings. This is called cross-sectional. So snapshot, it's as if I'm taking a photo a one time of a certain incidence, okay? Longitudinal research, this is over time. This is very important. The more advanced research methodology. You collect data not just once. You keep going over and over again, and you study the patients, for example, for starting now, and you follow them up like in cohort studies. Sometimes in genetic research, in rare syndromes, you do this. You follow up the patient longitudinally, so through time. This is an important classification to understand. And also as a beginner researcher, you can't do that. It requires a whole team, it requires resources. So it's best to start with cross-sectional research design. Can you repeat the point of A? Okay, sure, let's go back. Okay, so as I mentioned earlier, the broadest and the most important classification of research is qualitative and quantitative. So when I use words and I'm conducting interviews or focus groups to explore patient experience, for example, this is called qualitative data. Quantitative research is when I use numbers. So prevalence of disease, incidence of disease, the number of patients who have the disease, the number of pediatric age group who has certain complications. This is called quantitative. You quantify, so you are giving me numbers, okay? So the nature of the information is one way to categorize research studies. Is it clear now, Riham? Okay, so let's go back to the chart. There are two types of studies, analytic and descriptive. Let's talk about the descriptive. You're merely describing what you see. So you have a questionnaire and you go out and you have your participants fill out the questionnaire and you describe what information they gave you. Qualitative research methodology is also a form of description. So I ask the patient in an interview or a focus group, what do you think about, what was your experience in multiple sclerosis treatment? And they will tell you in their own words, you're just describing. You are not getting involved or taking action, just describing what you see. صح ولا؟ There's another branch called analytic. Okay, so analytic is one, you do experiments This is what we call clinical trials. They can be randomized or non-randomized. You can have one group or several groups, and you compare. So for example, group A, I'll give them medication C, and group B, I will not give them any medication. So group A, I will give them the antibiotic. Group B, I will not give them the antibiotic, okay? And C, what's the difference? Does the antibiotic work ولا لا? Does that make sense? Okay. إيمان معانا? Does that make sense? Okay. There are types of studies that we consider analytical, but you don't give the patient any intervention like medication, or you go back to you follow them up in real life. Okay, so or you go back into their files over time. So these are called cohort studies and case control studies. So I follow them up. I decide this one has breast cancer, this group, and the other group has no breast cancer. And I want to know if there's a relationship to smoking. So I will follow up the group that is a smoker and non-smoker and see who develops cancer. I'm not taking action, but I'm analyzing the behaviors of the participants and determining whether there's relationships between them or not. So this is very important. Okay, don't worry, we will go deep dive in a few minutes in these types of studies, but generally now I want you to understand how we categorize it. We mentioned the nature of the information, the utility of the content, and time. Sometimes we just take a snapshot in time, sometimes it's longitudinal research. On the basis of method, this is where we stopped. On the basis of method of research, we may classify research into 5 different categories, okay? So just for you to know, usually we don't do this in healthcare, philosophical research. This is more common in the humanities. So philosophy, أدب إنجليزي, اللغويات, they usually العلوم الشرعية, their research is more philosophical, okay? So they don't go and do questionnaire and they collect data and they do these things. No, they discuss philosophical ideas, okay? And they might depend on certain sources of information, like previous books on theories, but they don't collect data in the way that we are used to. This is uncommon in healthcare. We don't usually do this kind of research. It's more of a humanities form of research, but just for you to know that there is this type, okay? There's also historical research. So historical research looks at the events that have happened in history and that have led to where we are today. Again, we don't do this in medicine or healthcare. It's usually something to be done by historians and people who explore history and anthropology, like archaeologists, for example, who explore the ruins of certain civilizations, the pyramids, the pharaohs. كيف يتم دراسة الأبحاث هذه والتوسع في العلوم هذه؟ من خلال فحص المناطق المعنية، صح ولا؟ They don't do a questionnaire to understand, for example, the ancient Egyptian history or culture. Do a questionnaire for who? The civilization is extinct. صح ولا؟ So what they do is they study the areas, the artifacts, they analyze according to what they see in the specific areas. واضح? In medicine and in healthcare, we don't usually do this. We have no relevance. It's more about history and archaeology, anthropology, and these things. Okay, but it's important to know as a beginner researcher, what is the extent of research and who does usually get involved in these types of research. Is it considered research? Yes, it is. Okay, not every research is a questionnaire. Not every research is a systematic review. The different ways of doing things depending on the science. Okay. So we mentioned philosophical and historical. Number 3 is survey research. Okay. It's quantitative. Okay. It can be subdivided, but this is not important for you to dive into right now. You just need to know that using surveys or questionnaires, you can collect data. There's also experimental research. So this is essentially clinical trials. So you give medication, you give an intervention to group A and group B, and see how they react differently. Okay. Case studies. This is usually to report unusual events. And someone commented earlier, can I report a rare syndrome without having done any intervention? Yes, you can, because you will be describing your findings. مو شرط أن يكون جزء منها علاج. So for example, you say a 20-year-old female, known case of so-and-so disease, presented to the dental clinic complaining of pain. Findings on X-ray were 1, 2, 3. This is usually aligned with so-and-so dental disease, but it's also different because it presented in this way. So you describe what you have been, what you have seen. This is called case reports, and there's specific journals dedicated to case reports, and you can publish one article in these areas. Okay. Is it clear so far? There's also, in terms of quantitative and qualitative, it's important to know that in quantitative data, one of the benefits is that you can include large number of participants. Some studies that you will find online or when you're reading, they have hundreds and thousands of participants, okay? Because it's easy to collect the data, either through records or through questionnaires, especially now because we do questionnaires online. So once you do that, it's easy to send a link to thousands of people and they will answer and many will take part. So the number of participants بيكون عالي جدا. In qualitative research, no, you are doing one-to-one interview, and focus group. Usually the number of participants is 20 to 30 maximum يعني. Because it takes a long time to collect the data. You have to do it manually. It's not like quantitative where you just send a link and people fill out. They fill out the questionnaire in 5 minutes, probably. It doesn't take too long. Okay. Let's talk about data. We broadly categorize data into primary and secondary. What's the difference? Primary data is something that doesn't exist, but I go out and collect it using the appropriate methods. So for example, the questionnaire. My questionnaire, I disseminate it to people, and people fill out the questionnaire. Now I have data. This data was not available before. صح? I call this primary data because it was not here before, but I collected it, okay, from the participants. Secondary data is data that's already present. For example, in a database. If your hospital has records or information on the patients already, and then I decided to do research and I find this data and I use it, this is called secondary data. Okay? Systematic reviews and narrative reviews are also considered secondary data because you're using research articles that's published. Okay? Is it clear? This is an important distinction. Please write in the chat if you need me to repeat it. Okay, so I'm going to ask you a question. Answer in the chat, please. Is a systematic review primary, depends on primary data or secondary data? Excellent. It's secondary data. مكتوب في الslide, but in any case, this is a very important point to remember. Okay, so let's talk about the research setting. Okay, the research setting, and I've mentioned this briefly before. Sometimes you can categorize research according to where the study is being done. So if you're talking about the community and the population, this is called public health. So you're talking about factors that affect health of a population. Clinical research, okay, it pertains to the assessment of safety, effectiveness of medication, diagnostic procedures and devices. You're talking about individuals, okay? So not the population, individuals within the population. Clinical research, it's done in phases. Usually it ends with post-marketing surveillance. And also here you can consider preclinical research. So what you do in the lab, microbiology, physiology, biochemistry, يعني مو كل شيء نسويه it will be on humans. It can be in the lab, it can be on animals, it can be on samples from patients. Okay, so keep that in mind. Anything in the basic science precedes clinical trials. Okay, so first, usually we do experimentation مو على طول on humans. لا, we first do it on animals. Okay. And specific procedures. So we give the medication, for example, an antibiotic. We give it to, usually we use monkeys, rats, rabbits, and see the reaction of the animals on to the medication. And once it finishes this phase, we can move on to the next phase, which is to deploy amongst humans and to experiment accordingly. طبعا, you don't go from animals to humans unless you have ensured that the drug is not dangerous, that it's safe to an extent to give to humans. Okay, so that's the idea of experimentation with animals. So in our observational studies, you do not intervene in any way, as I've explained. So for example, if you're describing a disease, risk factors of a disease, smoking, diet, exercise, if you're describing these things, you're talking about an observational study. Case reports and case series, you are describing only one patient, okay? Case series is when you do a group of patients that have similar, but it's a small group, okay? So this is very important, and I really encourage you, if you are just starting out in research, this is a good area, and you have access to patients and rare presentations. It's a nice area to start with. It's manageable. Analytic research designs is you examining the associations between risk factors and diseases. Okay, so there's an exposure, for example, let's say smoking, and the outcome, cancer. Okay, so you are trying to determine if there's a relationship between smoking and cancer, exposure and outcome. Also, if you're trying to understand the prevalence of disease and risk factors in a population, this is called cross-sectional, okay? What are the benefits of doing cross-sectional? It's quick, it's easy, it doesn't require any, it's inexpensive. You can study multiple exposures and outcomes. What are the disadvantages? You're doing it once, you're collecting data once, so you can't understand the relationship over time. So I can say the relationship between cancer and smoking, the number of patients that I've had, is significant with smoking. Okay, so when I say that, I can only say it for this point in time, but I cannot establish a causal relationship. So I can't say smoking causes cancer. I can't say that. I can just say patients who had cancer were also smokers. You understand the difference? I cannot establish causal relationship. Okay, so the factor of time is important. طبعا, why don't we do it? Because it takes a long time. You have to follow up the patients have to agree. Maybe they agree now, they will not agree in 2 years that you follow up their case, and so on. What's what I've just described is the cohort study. What about case control? What's a case control? Does anyone know? If you know, write in the chat. Exactly, Hannah. You start with the disease. So you choose people who have cancer. Exactly. You start with the disease. Excellent. So having the disease, you choose subjects according to them having the disease or not. And then you compare it to a second group who doesn't have a history of the exposure. Okay. But وش الادvantages here? It's quick, inexpensive, because you're looking at patient files to begin with and following up the cases that you have chosen. The disadvantages is you cannot calculate the incidence of disease. Okay, so how many new cases are happening based for this disease. Okay, so this is important. Again, with the temporal sequence, establishing a timeline and following up longitudinally is oftentimes difficult to do. Okay, so you're more prone to recall bias. It's inefficient for rare exposure, so you can't use it for rare diseases. So this is important. An example of this is the Interheart study. If you Google it, the study will come up and you can read more about it. It's a good example, I find. It explains to you a global case control study of risk factors for MI. Okay. Oftentimes we compare case control to cohort studies. The cohort study design is prospective. So at the beginning, the disease has not occurred. None of your participants have the disease, but you choose them according to the exposure, having the exposure. So for example, smokers versus non-smokers, and you follow them up. Or you say, I'm not going to do it prospectively, I'm going to do it retrospectively. So the disease has occurred at the time you started your study and you moved back. I'm going to take Isra, you've just raised your hand. Please go ahead and speak. Okay, it seems like you are raising your hand by mistake. In any case, there are examples of cohort studies, the Nurses' Health Study, the atherosclerosis risk and community study. These are, if you Google them, they'll come right up and you can find them readily and you can read more deeply into the study. But generally, they follow the same rules I have outlined here. Okay, so we talked about observational studies, وقلنا case control, and we said cohort studies. Now we're talking about experimental studies. Experimental studies, they involve intervention. So you're giving medication, you're giving radiological intervention, you're taking action. Okay, so you're giving your patient something to Just out of curiosity, has anyone here contributed to a trial? Have you been part of a clinical trial? Okay, there's the reason for that is they're not very common to do. But nowadays, with the entities that I mentioned earlier, they're being done more and more. So you'll probably see them in your institutes. You'll be doing more clinical trials, and ask in your research centers. I'm sure you will find opportunity to be involved. Okay, so these are very expensive to do. They measure the efficacy of a treatment, so they determine whether this medication is good or not. Usually they have more than one group. One group receives the intervention, the other group does not receive the intervention. And that way we can determine whether the medication works or not. They are the gold standard in clinical research, okay? They are the gold standard. So if you do them, they're the best way to determine how to whether this medication should go to market or not. Okay. I'm going to stop here. Let's take a prayer break and lunch break maybe. How about we come back 12:30? Or do you need more time? 12:40? Let's come back at 12:40. So let me just quickly recap while everyone's rejoining what we were discussing prior to the break. We talked about how to categorize research. Remember, now we're talking about introduction to health research. So understanding how research is categorized is essential. It can be categorized according to quantitative, qualitative. It can be categorized according to the nature. So of content, and we mentioned philosophical research, historical, observational, and we talked about categorization according to the nature of analysis, so observational versus analytical. وقلنا إنه analytical contains one branch that is experimental, and we know it as clinical trials, okay? So this is where we have stopped. What are clinical trials? They're experimental ways of doing research. They are considered the gold standard. So if I want to prove something, I have to perform an experiment in a clinical setting where I introduce an intervention. And based on the results of this study, I can deduce, is this a good medication? Can it be used? Is it effective? So this is super, super important to know. The disadvantage of doing this type of study, although it's the best standard, you have ethical concerns. You are performing an experiment on human beings. So consider that for a minute. You might give them something that harms them. You might give them something that has no benefit. So there's ethical considerations. Here, the IRB plays a very significant role, very significant role. They try to help you determine what ethical concerns there are in your research. The second disadvantage is the cost. It's costly to do clinical trials. It's not, it needs a large grant for you to do it because the medication itself, the production of it is super expensive, okay? Feasibility. Now that you've decided to do a clinical trial, where will you do it? How will you do it? Wa alaikum salam. Those who are rejoining, we're talking about clinical trials, which is the gold standard. Okay. Feasibility, we can talk about the participants. When they take part, they have to abide by the rules, and you have to ensure that you choose the participants who you think are going to help you succeed in this clinical trial. بمعنى I can choose participants وبعد جلسة أو جلستين من أخذ العلاج يقرر المريض إنه ما عاد يبغى يكمل. For whatever reason. Okay, so this is an issue. So I have to be very, very careful in choosing who is involved in my clinical trial. Okay, also, can this trial be executed to begin with? Who will produce the medication? What company? How will they bring the medication to the center? And then how are we going to disseminate it to the patient? So you have to consider these aspects of research design that greatly influence what you do. Non-compliance. So you might give the participants the medication. They might not take it on time. They may not take the right dose. مرة أخرى, you have to be very careful in how you choose your patients. Okay, there are several examples about clinical trials. If you just hop onto the PubMed, you can find many. Just Google clinical trials, you will have many examples. I mentioned earlier that there are 4 phases to the clinical trial. Let's talk about them briefly. Phase 0 is referred to as the workbench to humans. Okay, so in this phase, I'm trying to decide whether the medication I'm using or agent is achieving what I want it to achieve. So for example, if I'm doing a trial for diabetic medication, and the idea is to lower glucose level, so the patient might have hyperglycemia, and my goal is to ensure that this drug lowers the glucose level. This is done in phase 0. Okay, this is the first step. Does it hit the target or not? Does it do the main thing I wanted to do? ولا لا? This is phase 0. After that, phase 1. Now you have to consider, okay, the drug does what I want it to do, but I want to consider the dosing. What dose is considered toxic? And what dose can the participant tolerate? Okay. But this is phase 1. Phase 0, we're trying to determine, does it do what I want it to do? Phase 1, I'm trying to determine the toxicity. You don't want to be giving too high of a doses. You don't want to be giving too low. So you need to figure out where is the limit. In phase 2, you monitor the drug activity, the safety, and feasibility evaluation. So for example, are the pills too big? Are the pills too small? How long does it take to become active? So you start paying attention to these specific details, okay? In phase 3, you compare the clinical outcomes to a control group. So you have 2 groups that have the disease, let's say cancer. Group 1, you will give them the medication. Group 2, you will give them a placebo. A placebo means they will take tablets, but it's not actually medicine. Okay, placebo. And you will compare the clinical outcomes. You'll see, does the cancer shrink? Do the symptoms subside? And you follow up your patients in both groups. Okay. Once you have determined that you are meeting your clinical outcomes, comes phase 4. All the while, in phase 0 to phase 3, we are still in the hospital setting, in the lab. We have not left. In phase 4, if the drug is approved, you can go to post-marketing surveillance. So you can deploy the medication in the market. You can deploy it, and you monitor the long-term safety of it. Okay, this is called post-marketing surveillance. Is this clear? Okay. An interesting question here, let me just go back. An interesting question here is, if I'm a researcher and I'm contributing to clinical trials, do I have to participate in all phases? Not necessarily. You can be part of the clinical phase 2 and phase 3. You can be part of the initial laboratory testing, and so on and so forth. So it's not necessary that you are involved in all phases, or you are the one who is doing all phases. In clinical trials, pharmaceutical companies are heavily involved, so you would be probably dealing with pharmaceutical companies if you decide to do clinical trials. Okay, this handbook, Oxford Handbook of Clinical and Healthcare Research, is a great reference for you to use to expand further in what we have talked about so far. It has a lot of detail, much of it I covered today, and it's a great reference to have and to go back to every so often. So I do recommend this book. Do you have any questions in terms of research design, which is step 2? Are there any questions? Are there any questions? No? Okay, so let's move on to step 3. Now, what have we talked about so far? We took a broad overview of what health research is and why it's important. We talked about research methodology categorization, and I recommended to you to see what is out there and what could be most relevant to you and your work. Now, once you have made some sort of, you might say, I'm interested in qualitative research. That sounds interesting. Or no, I like to be deductive in my thinking. I like quantitative research. Whatever the case may be, everyone does literature reviews. But this is our next step. Let's talk about how to do a literature review. If anything, today's course, you need to walk away knowing how to do a primary search, a simple search, okay? So if you haven't been paying attention, now is to pay attention and to focus to what I'm about to explain. Literature, how do you criticize it? Okay. Once you decide to review the literature, what you're trying to do is collect as many articles as you can find, talking about the topic of your choice and summarizing what the scientific community has to say about the topic at hand. Okay, so much has been written about wound care and diabetes. Okay, a lot has been written actually. So it would be your job in a literature review, so you're doing a systematic review or you're doing a research project with a questionnaire. كده أو كده, you have to write a literature review and you have to explain what has happened previously, what was done by colleagues, okay? The more you read, the better your project will be. لأنه you will understand what others have done and what issues they faced, and you can avoid them, and you can use, maybe you can find better tools, so on questionnaires or ways of exploring certain topics that might have been better than the initial idea you had, okay? Reviewing the literature is an essential step beyond determining the topic and refining the topic, okay? Any research project you do, any publication you have, لازم يكون فيها literature review. Okay? So it's not enough to go and get a questionnaire and collect data and then report what you found. You have to situate what you have proposed within the broader context. So you say, so-and-so gathered information on hypertension and smoking, and they found that there's a relationship between the two. In our study, we replicated the methodology, but we included several institutes. فهذه نقطة مرة مهمة. Situating what you have found within the broader sphere of literature. Okay, so you cannot just report what you did. ما أستفيد منها هذه. It's not beneficial. I need you to tell me what happened previously, how your study is different, how your study is related to previous findings. Does it concur with previous findings, or is it different? Why is it different? So this is an important reason why we situate our findings within the literature review. Generally, a literature review is an assessment of body of research that addresses a research question, okay? It's usually organized, much like an essay, but different from an essay in that it is critical, okay? What we include in literature reviews is scientific publications and peer-reviewed journals. We cannot depend on Wikipedia, for example, or blog posts that we read and we found interesting. Even if they are correct, they're not scientific. So always keep an eye on peer-reviewed journals, quoting peer-reviewed journals. And I've made an effort today to show you how that is done. You see, I'm using references to the definitions that I have put. These are peer-reviewed articles or scientific books. You should do the same. Okay? If you decide to quote references that are for common use and not for scholarly communities, that lessens the value of your publication. And most often than not, you will not be published. Okay, so this is an important point to keep in mind. WebMD, for example, I usually see students do this. They use WebMD as a reference. WebMD is not an appropriate reference. It is a website for public consumption and to help lay people understand better the diseases that they might have. But it's not for you as a scholar or a health professional. Okay, let's talk about the characteristics of a good quality review of the literature. A good review of the literature has to be comprehensive. What I mean by this is you can cover all aspects of a topic in equal depth. So, for example, if you write an article, literature review about diabetes, but all of the studies that you have used are from Canada, for example. You have not included countries, for example, from the UK, from Europe, from Saudi Arabia. I cannot say about your research that it's comprehensive research. Okay, so it's very important that you pay attention to this aspect and ensure that you are covering different aspects of the topic. Beyond, I'm just giving examples, but we can go on and on with the mistakes people make in this area. You can مثلا talk about diabetes treatment, and you fail to talk about diabetes epidemiology. So it's customary to write about the epidemiology of diabetes and how it's a health concern. You compare between countries, and then you talk about the diagnosis, then investigations and treatment. Okay, so being comprehensive is essential. If you give me just one part of the puzzle, it's very difficult for me to gain a full understanding of what you are trying to present. Okay, of course, there's a challenge here because always in publications, there's a word count. So you cannot exceed 5,000 words. Usually this is the average. So the challenge is always to how do I address all aspects, but at the same time be concise and abide by word count. This is an ongoing challenge for every scholar. So if you face it, don't worry. It's a common issue. The second characteristic of a good quality review of the literature is being up to date. Okay. When you start researching, articles from 20, 30 years ago will come up in your search. It's the lifespan of medical information is 5 years. 5 سنوات وتتعدل المعلومات, it develops, it becomes different. Make sure that the references you use are يعني keep it in the past 5 years. يعني max 10 years, depends on what the information you're trying to quote, but always keep it up-to-date references. Anything older than that, you will run the risk of having outdated information. So try your best to be up to date with your references. Past 5 years should be a good range to keep. Does that mean if I have an article that is older than 5 years old, I cannot use this one? Something in 2018? No, that's not what we're saying. What we're saying is, what's the type of information that you're getting from this article? It plays a big role to make that decision. Okay, so pay attention to the references and what kind of information you're trying to quote. If you find something in an article in 2018, you might find a newer version in 2022. So you look for that information in other articles to have more up-to-date reference, okay? Also, a good review of the literature should be systemic. So, as I mentioned earlier, you start with the definitions and the prevalence of the disease. So you say diabetes mellitus is an endocrine disease that affects the pancreas and the production of insulin. It has two types. So this is me defining what the disease is. Yes, أنا البحث حقي about wound care amongst diabetics and elderly group, but that doesn't mean that the breeder knows what I'm talking about. So I have to be systemic and I have to explain concept by concept. And then I talk about why is diabetes important. I usually say the prevalence of diabetes is for the Kingdom of Saudi Arabia, it's the 7th most prevalent disease. In 2030, the number of diabetics is going to increase by 30%. This is a national health challenge. Okay, so now I talked about defining the disease and I talked about the epidemiology of the disease. I can go into more depth about how it's being investigated. So we use the oral tolerance test. We use random testing. We have at-risk groups. So I go one by one and I explain and get into more depth. The mistakes people make are usually they often start talking about diagnosis and treatment without definition of the disease or the topic at hand. Okay, this is important. You have to be systematic when you're writing, and you have to use a stepwise approach. Otherwise you confuse the reader. مرة تتكلم في الابيديميولوجي بعدين ترجع تتكلم في symptoms. You have to be clear in the way you're writing. So what I usually do in order to organize my literature review, first off, I start with bullet points. 1, definition of disease. 2, epidemiology of disease. 3, symptomology and signs of the disease. Investigation, treatment, complications, for example. Okay, see, الآن صار عندي رؤوس أقلام أقدر أنطلق منها. And I write each bullet point as a whole paragraph. And I find the appropriate references and I include them. Okay, the mistake people make is oftentimes they just take pen to paper and they just write without organizing first a framework. If you do that, you run the risk of being unclear and not systemic. Okay, so this is important. Always ensure that when you do a literature review, that you explain how you did it. And we will get into that in a bit. But make sure you explain, I used the database so-and-so, I found 300 articles, I read the abstract and excluded some because they are irrelevant. There's a specific way to do this one. The language is essential. So it should be free from bias. You should not, for example, if you are partial to a certain institute, you make all your studies that you use your references from that institute. We're not here to judge. We're here to present the facts. Okay. So if you reference something or you present something, make sure that you are as free from bias as possible. So using words like this study was good or this study was great is unacceptable. Okay, you just present the facts. This study was a cohort study that was done in the United States. It followed patients of colon cancer and who are smokers. I did not say my opinion here. I'm just describing the facts. The study had a low number of participants, which influenced the quality of the study. This is a fact. كان عدد المشاركين متدني، فبالتالي استنتاجات البحث أيضا غير جيدة. يعني ما نقدر نعتمد عليها كثير. So this is very, very important. Okay? Ensure that the language is sound. For most of us, English is not our first language. So soliciting the help of English editing companies is always recommended. Actually, some peer-reviewed journals, they require that you submit to an editing company and provide proof that you did before sending your work to them. Okay? Again, the search strategy must be clear. Accurate references should be given. So you can't put any random reference. You have to make sure that your references are correct. This is important. Okay. What affects the review of the literature? You can write in the chat. Any ideas? It's influenced by the researcher's background. So an experienced researcher finds it easy to prepare a review. So if I'm someone who's used to dealing with diabetes and reading up-to-date diabetes articles, it will be very easy for me to write my ideas down. But if I am not, it takes a long time to come up with the articles, and you may experience this in the beginning, but that's okay. Don't despair, it's normal. Sometimes some topics are easy to write about and other topics are more complex. So it will take some time to examine the literature and ensure that you can present it in the right way, especially if you are not used to the way they did the analysis for example, advanced statistics or in clinical trials. It will be difficult for you to discern, okay? So we recommend here that you always have the help of the team. So assembling the right team helps you address these complex topics. 3, availability of resources. Okay, to do a literature review, you need beyond, I'm sure everyone has a computer, internet facility, and most hospitals and universities have those now. You need journal subscriptions, okay? So for us in Saudi, if you have an institutional email, you can gain access to literature through the Saudi Digital Library. Okay, I'm pretty sure that all hospitals and all clusters and all universities have this access. Otherwise, you'll notice when you go to, because most articles are not free. Some are open access, but the majority, no, they're not free. So you have to have subscription. You don't make the subscription yourself, your institute does. So I encourage you to ask in your research center how you can gain access to these databases. Another factor that influences literature reviews is the time it takes. You're talking about sifting through large amount of data and articles. So you'll be reading a lot and trying to come up with themes. And so this takes time. Make sure to carefully plan out your time frame and ensure that you have enough resources to do this. Otherwise, you can make your study more manageable by making more specific objectives. So for example, if you do your research and you find that there's 1,000 research articles written on your topic, you might have to make the decision to say, I cannot review 1,000 articles. Let me put some parameters. So in the past 5 years, and anything beyond that, I will not include. So it will go from 1,000 to 200 articles. So now it's more manageable within your time frame. So sometimes you have to make these decisions as a researcher. Another factor influencing systematic literature reviews is the availability of the support system. If you have a good team, you are able to produce a good review of the literature because you're not working alone, you're not critically analyzing the results alone. But if you don't have, it's just you or one or two more people, it becomes exceedingly more difficult to perform the review. The more well-rounded the team, the better you'll be able to conduct. Also, it's important to note that your research team for literature review, if it's a simple literature review, you don't need many people. But if you're doing a systematic review, for example, you need help from a statistician, a biostatistician, and someone who's probably trained in qualitative research, and so on and so forth. So the more competent of a team, the better the results of the review. Okay, so now we understand what a review of the literature is. We know what are the qualities of a good review of the literature, and we have talked about the factors that influence literature reviews. What's the purpose of doing a literature review? You can share in the chat. What's the purpose? Why would you do a review of the literature? You are building, you're not never starting from scratch. You are building on previous knowledge. So it's important to ensure that you know what that previous knowledge is. What is already known about the topic? I might decide exactly, Amani, يرتب الأفكار ويوضحها. It clarifies what you're trying to do. You might think that your idea is the most novel idea and you want to go and do something about hypertension and complications of hypertension. But when you read in the literature, you find out that it's already been written. A lot has been written about this topic. Okay, so review of the literature يفتح عيوننا على إيش اللي تم نشره ولا يحتاج إن إحنا نعيد اختراع العجلة. هذه نقطة مرة مهمة. يرتب الأفكار، يوضحها، ويصير عندنا إدراك إنه لا، هذا الموضوع نشر فيه كثير، ما يحتاج إن إحنا نزوره مجددا. خلينا نبدأ من حيث ما انتهى الآخرون. This is important in research. If you read research, they have a section في conclusion, في discussion, recommendations for future research. It's a great place to find ideas. So where people have ended, you can start. It's يختصر عليك المسافات and you can launch your idea fairly quickly based on their results. Okay. It helps you also to narrow the problems to be studied. This is also crucial. Once you see other studies, you'll notice that while reading them and critically analyzing, you'll say, oh, their objective was too broad. لو أنا مكانهم I would have made it more specific, and so on and so forth. So the previous research allows you to see those mistakes in people's work and helps you refine yours better. Okay. Originality, there's so much being published nowadays, and you have access to data from around the globe. So reading it will help you determine what is original and what is not original. It's okay for beginner researchers to replicate studies, and you change a few factors. So this study was done in Pakistan, this was done in Egypt, but was never done in Saudi population. So it's okay for you to do that. But as you progress, the best thing is to find ways to be more original. So not only replication studies with changing certain variables, but also to kind of try to be novel in your approach. Most often than not, we're not versed in every methodology, okay? So if I research hypertension and smoking, it will show me what studies have been done and using what instruments. So for example, is there a validated questionnaire regarding this topic? You will find it in the literature. Is there a recommended way in which studies have been done? What challenges did they face while conducting the study? Is the sample size large or small? Is this something I'm going to face in my research or not? So seeing how others have done their research project helps you design your research a little bit better. Okay. It also helps expand the way you think about how certain topics are studied. So for example, you might think about hypertension and smoking from quantitative way. So you're trying to find a relationship, you're trying to do a cohort study, for example, or an observational study. But in the literature, when you start reading, you'll notice that they have done a lot of mixed methodology. So they go for interviews first, they understand the patient perspective, then they design a tool based on the patient perspective, and they disseminate the survey on a wider scale. Okay, so this is super important to keep in mind. It helps you think of different ways of exploring the topic at hand. You will always need comparative data. So once you have results for your study, you may think, is this okay? The relationship is significant. What does this mean? So if someone else did the study on a larger scale in a different area, different country, you can compare. You say, we found a significance between smoking and colon cancer. So did so-and-so in the US, so did so-and-so in China. So our results support previous findings of this study. So, or the opposite, you might say, we did not find a significant relationship, while in China and in the UK it was found. So how is our study different? This comparative data usually comes up with good feedback that you can write in the article itself. Clear? Shall I go on? Like, what are the types of reviews of the literature? We have a traditional or narrative review. So this one, you take the main ideas and you summarize and critique them, okay? And draw some conclusions. So you're basically going to tell us generally what has been said in this topic. Do you cover every article that was published on the topic? It's not possible to do that. In systematic reviews of the literature, it's different. This one is more rigorous. So you will have a defined approach. You will say, I will use these 4 databases. I will use these keywords. I will make a list of published and unpublished studies. I'm going to discuss dissertations, PhD dissertations. So it's a bigger project. It's more methodic and more rigorous. And as a result, the findings are better than doing a narrative or traditional review. طب الأول هذا اللي ذكرته, you do it in as part of a research project, okay? Systematic reviews, this one you do it as a standalone project. هو هذا بحد ذاته مشروع بحثي, okay? Systematic review. You also have something called meta-analysis, okay? So this one, we take studies that are similar. They all studied the relationship between hypertension and smoking. We take their results and we do advanced statistics, and we come up with a determination of the relationship. يعني أخذ جميع الدراسات اللي اتعملت على هذا الموضوع وأسوي لها معادلة حسابية وأطلع باستنتاج يعني مبني على رقم، لكن كأني سويت دراسة على كل دراسة كانت 1000 شخص، أنا ممكن أستنتج بناء على 10,000، فصارت الدراسة الآن أقوى. Meta-analysis. So it's important to engage with these different types of studies. You will learn quite a bit, but it's also important to note that these studies are not done alone. You have to do them with a team who is capable. There's also a method synthesis. This is not statistical method. You use it to integrate and evaluate. So you take many studies and you identify common elements, but without the use of statistics. هنا الفرق بين الميتا analysis والميتا synthesis. Okay? A common question is, can I publish a review without doing a study questionnaire? Or yes, you can. If it's a systematic review, of course. If it's a meta-analysis, of course. Narrative reviews, yes, depending on the field, you can, if you are very clear on why you did it. Traditional reviews, to write a review article, this is very difficult to publish on its own. Usually you do a traditional review as part of a research project to situate your topic, to say what others have done before you. بس كده لوحدها تنشر, very, very difficult to do. It's no longer acceptable in the field to do that. واضح? This is a very important point. Is this clear? Okay, let's see. It's too soon for a break. If you don't mind, let's keep going. Okay. So this is the literature review in as a definition, as a way of doing it. Now, how do I do a search query? Okay, now I understand. I need databases. I need keywords. How do I do the search query? Okay. First of all, you need to be familiar with the databases. In healthcare, we use PubMed. This is the go-to database for medical research. Okay. What are the benefits of PubMed? It's free. It's available 24/7. It has over 26 million records and from 5,500 publications. The Lancet, BMJ, all the known publications. It is updated daily. It covers medicine, nursing, dentistry, veterinary medicine, pharmacology, healthcare systems, and allied health. Anything in the healthcare, it's covered in PubMed, okay? The scope is international, so it will bring up studies from different countries and from different publications within those countries. مثلا عندنا في السعودية the Saudi Medical Journal, the طيبة University Journal for Medical Science. Okay, so they are all indexed in PubMed. If you research there, they will come up. There's something relevant to you. Okay, now that I know what the database is, how do I search in it? Okay, so I'm going to explain the concept first. بعدين بنروح على الويبسايت together and we will perform the search. Okay, there's something called Boolean operators. Boolean operators. What is this? It's the use of the word and, you see here, the word or, and the word not. So let's assume this pink circle is cancer. The keyword is cancer. And the blue here is smoking. Okay. I want from PubMed to give me the articles that are talking about cancer and smoking. So this area here, where they overlap. I don't want all of what's written on cancer. I don't want what's all written about smoking. I just want the article speaking about the two topics. So now, by using and, I can cut all this out. Okay. Sometimes I have a topic that's, for example, smoking, or smoking marijuana. Okay, so any article that has smoking in it or marijuana, include them. So I say smoking or marijuana. It will include all these articles and the overlap. Then the last one is not. Say, for example, there's there's something that you don't want to come up in your research. So you want anything that's written on smoking, but you don't want marijuana studies. Okay, so you write smoking, which is the pink one here, and then you write not marijuana. It will go and find everything that has to do with smoking and remove anything that has marijuana in it, because it's not your interest. واضح؟ Is this clear? Are Boolean operators clear? Okay. Always in literature review, think about less is more. Less is more. If you focus on your topic, even though you have a fewer numbers of results, the results will be more relevant. But you have to spend time thinking about your keywords. For example, you're doing a research study on leadership. So you say leader, leaders, leader development. So you do more than one search and see what kind of results come back. And you can refine your keywords. So this is crucial. Sometimes the PubMed will bring out words that are not relevant to your study. Okay, so the first thing to do is to focus on the keywords. Try to refine them more. Okay. If you open the PubMed website and write the word stroke, بس كده نكتب stroke, okay? It will retrieve around over 200,000 records, okay? So is it reasonable that I will read over 200,000 articles to do my literature review? No, it's not reasonable, okay? So it's important to first experiment, use the term, then do a more in-depth search. So for example, here it's recommending to using swimming strokes. Okay, that will completely change the results that you have. Okay, so let's see here. This is another screenshot. In addition to using keywords, you can use mesh terms. So this is a very nice way of focusing your search. In PubMed, they've created subheadings. So you can say, I'm not just going to use keywords. Let me go in and see what subheadings are relevant and choose according to them. Okay, so this is another way. For me personally, I've never used mesh headings. I always use the keywords. But for me, I usually just do a literature review as part of my work. I don't do reviews for systematic reviews and narrative reviews. They might be relevant here. Okay. You can restrict. So notice here that when we put stroke as the major subheading and we searched, قل الرقم إلى 79. Okay, so what does that mean, major topic? That means in the major topic for the article, it's about stroke. Where here, when we retrieve 200,000, if the article is talking about stroke, okay, as outcome or just mentioning it as complication, it will bring up the article. But when you use the mesh terms, it helps focus your study more. Okay. So this can save time for you if you are someone who's looking for very specific information. Notice here that they have also provided definitions for the term that you are researching. So if you research anything, it will provide a definition and you can say, I agree with this definition. No, I disagree, and decide to change the keywords accordingly. Or you might agree with it and keep it as the mesh term you would like to use. Okay, so this is very important. Here's a question. In using databases, do you use synonyms? Can you write heart attack and myocardial infarction? Yes, you can write, for example, heart attack or myocardial infarction and see what comes up. So it's either this one or that one. There's really no easy way to do this. You have to experiment several times in order to come up with the correct combination of keywords for yourself. But in any case, you can develop the search strategy the more you use PubMed. Okay. This is a tree for how the database is organized. So it will go, for example, anatomy categories, body regions, and then go into more depth. So you can choose based on the region. For example, umbilicus. If you are researching hernias and you just want the umbilical hernias, you don't want inguinal hernias, then you would use this subheading, and so on and so forth. بهالطريقة you can really focus your search. Okay. Each article is tagged with 10 to 15 subheadings. One article about umbilical hernias is not going to be under umbilicus and that's it. It probably will be under hernia, it will be under surgical procedures, it will be tagged several times, okay? Who does the tagging? There's a team that does the tagging, so it's not you. The PubMed team do this on a daily basis. Clear so far? I know I'm saying a lot of details. We will have an example and that will clarify in a few minutes, but do you have any questions so far? In the same way, you can include subheadings. If you have any question, write it in the chat, I'll get to it. If there's any one topic that I'm not interested in, I can exclude it. So I can choose, I do not include this option. I don't want anything to be included about brainstem infarctions, for example. Okay. And this will exclude any articles in that regard. Okay. Okay. Now we are going into more depth. In the beginning, we were only using stroke, 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 صح? هلا, we're adding to it therapy. I'm interested in therapy. Once you add the term therapy, and let's notice that the retrieval is way less now. It's 43,830. When we started, it was over 200,000. So now it's getting less because I'm trying to focus what my search is. So I chose therapy. This is what I added to the stroke main concept. It's now narrower, okay? If you make sure that the stroke is the major subheading, and an article from the beginning is about stroke, it's cut by half, 25,600. Of course, this is still unmanageable as a number. It's not something you can depend on, but this is just for you to understand the general idea and to know that there's so much published work. So the choice of keywords, the choice of topic, phrasing your objectives, كل هذه مرة مهمة to make sure that we are very focused in what we're doing. Okay. Okay, so these are some of the subject subheadings that you might see in the system. It again covers nursing, dentistry, pharmacological sciences, allied health. So whatever the case may be, so as long as it's healthcare, you can find it here. Okay. Okay. In the search bar, you can do advanced search. Okay, so you can say, I'm going to do stroke therapy. I'm also going to do patient care team. This is my second interest. Automatically, PubMed will generate this table for you. And every time you search something, it's going to tell you the items found. Let me draw your attention here. When I zeroed in on patient care team, it returned 476 results. Is this manageable? Of course, it's way more manageable than doing 100,000. But this goes back to your objectives. How clear are your objectives? On that basis, you can determine the key terms and you can come up with a very manageable number for literature. Okay, there's also filters to be used in PubMed. So you can say, for example, I only want clinical trials, مثلا. I only want things published in the past 5 years. I only want studies that are done on humans. I don't want animals. This lessens the filters. And there are several more. So if you click on any one of them, it will come up with more options. So for example, language, age, journal categories. Okay. Clear so far? Any question? Okay. When do you use mesh? When do you use major subheading? When do you use several subheadings? Use mesh when unfamiliar with the topic. So you don't know anything about the topic. So you're not really good at generating keywords. Okay, you can't generate keywords. That's fine. Go ahead into the mesh. Someone already categorized for you. So they'll say stroke, under stroke, there's epidemiology, there's therapy, there's long-term complications. You can go from there. So if you don't know much about the topic, using mesh is a great way to start. Okay, and to purify your idea. When do you use major subheadings? You use that if you did the mesh and then you realize that there's 200, 300,000 things written on, articles written on the topic. This is too much. So you have to focus. Are we talking about therapy? Are we talking about diagnosis? So using major greatly limits the number of and focuses the review. If you are interested in a particular facet, so you say to me, I'm looking for interprofessional teamwork, multi-professional teamwork in treatment of stroke patients. Okay, this is very clear to me. So I add that with using the Boolean and. Okay, so it's important to go through this process. It takes a few hours, I would say, to sit down and really purify what it is that you want to reach. But if you diligently follow the steps, you can come up with a reasonable number and something that helps you answer your question. Okay, so this is very, very important. Okay, so your literature review depends on the question. It really does. If your question and your objectives are clear, it will be easy to do the literature review. If your question is too broad and you're all over, it will be very difficult to come up with the mesh terms and the keywords. Okay. Sometimes you reach the literature review stage, and which is step 2 for us, and you realize, oh no, I have to go back and I have to work on my question a little bit more based on what I found. Okay. In the slide, you'll see it gives you an example. So it says, I researched myocardial infarction and prevention and control of myocardial infarction, and it came up with 9,000 articles. This is too many for me. How can I focus it more? You can by ensuring that you focus on a certain population. So you notice in your practice that African American populations are what visits your clinic. So why would you do on other ethnicities? So you would choose African Americans or Arabs or a certain gender or a certain age. You see, so this is important. This helps you bring down the count and make sure it gives you the information you need to answer your question. Okay, so this is a nice funnel that shows you how first you have a lot of information. Mesh headings are the broadest way to think about how to organize all of this. And then once you use the major headings, it will narrow the topic. You can filter them. And based on the results, you can do further filtration using subheadings. At the end of it, you will have the essence of what PubMed has to offer on the topic at hand. Okay? This is very important to go several, like you have to do several exercises in order to get acquainted with it. And combining topics. So for example, in the beginning, I told you about wound care and diabetes, diabetes in type 1 diabetes and elderly age groups. All of this limits and helps me answer my question. Okay? Any questions? No questions? Okay. So notice here, this is an example of when we did the research for myocardial infarction and African Americans. This article shows up ACE inhibitors in African Americans with hypertension associated with worse outcomes as compared to other antihypertensive. Is this relevant to what I was doing in the beginning? Very much so. It's very close to the area I'm trying to research. Okay. It's talking about African Americans. This is my group. It's talking about myocardial infarction or one of the causes of myocardial infarction, which is hypertension. So now I'm more relevant. Okay. And closer to answering my research question. Okay. So to begin with, I suggest you use the template shown here. It will help you clarify and put everything in one page to begin with. So what are the concepts that I'm trying to examine? Here you'll write your search question. And then the database PubMed. Of course, there are other databases, but for the sake of this course, you don't need to know about the others. The main database is PubMed. Focus on mastering PubMed. You can write the concepts here. You can say, for example, pediatrics, Down syndrome, genetic disease, chromosomal abnormalities, and you go from there. Okay, you put them into PubMed and see what results come back to you. And according to your question, you refine and go over the process 2 or 3 times. Okay? Are you going to have any limitations? This is an important question. So for example, you say to PubMed, only give me articles that are in the English language. And this is what most of us are going to do. You're going to limit based on language. Okay, so this is very, very important. Okay, you can use timeframes. So as we mentioned, the past 2 years, the past 3 years, and so on and so forth. Okay. All right, so I think it's best if we just head over to PubMed. Let me share my screen with you so you can see me do a live search. Can you see my screen? It's showing Google Chrome. Can you see it? Okay, super. So when you go to Google, just Google PubMed Central, it will bring up the website. Okay. Go to the website. It looks like this. You can make an account for free and you can log in. Okay. This is the search bar. So here you can search for the topics that I mentioned earlier. There's some information here about the website itself, so you can go through it and see, learn more about the website itself, the database. Now, Nafisa asked me earlier today if she is interested in depression and medical students. What's the next step? So stay with me, Nafisa. What's the first keyword that you want me to put in according to what I explained earlier? What's the first keyword? Depression. You'll notice that PubMed is making suggestions for me. Bipolar, postnatal. So let's keep it at depression and search. Okay, now it has come up with results. Let's explore the results. First thing that I'm seeing here is the number of items. The numbers of items that it has returned are 1,036,272 articles. So in PubMed, the database, there are over 1 million articles published with the keyword depression. Of course, you will not go and read all of them. There's some things that are not relevant to you. So let's use a Boolean operator. We said and or not. Let's use and. What's your second key term, Nafisa? Students. Okay, so we can say students. And go for search. You see, Nafisa, now my results are 173,596. You see, a minute ago it was 1 million. Now it's less than 200,000. So it's very important to ensure that you choose the correct terminology. Now, when you said depression, did you mean postnatal depression? Did you mean major depressive disorder? Do you mean bipolar depressive episodes? Now, if you read here, you'll get some idea. The problem of malnutrition associated with major depressive disorder. Okay, so now you see your term has changed a bit, right? So you're going to add major. The correct name of the disease is major depressive disorder. Do you want to change to that? Okay, so we can search. Now you're down to 60,000. Global trends and regional differences in the burden of anxiety disorders and major depressive disorders, attributed to bullying, victimization in 204 countries. I'm now thinking, I will repeat Jamal, but let me stay with me now. Let me say, ask you, Nafisa, do you want to do all students? So any college student, any high school student, Or do you want medical students, dental students? Okay, so you're now focused on medical students. Now, notice that the number is going down. The more specific I become, the more the results are closer to what I want to closer to my research question. So now prevalence and correlates of likely major depressive disorder among medical students in Alberta, Canada. Now, is this closer to the ideas that you are having? A pilot study of symptoms of major depressive disorder in medical students at an osteopathic medical school before and after high-stake exams. This one sounds maybe something that you would be interested in. Gender disparities in symptoms of depression after medical school exams and students' coping strategy for post-exam depression symptoms. I would say that this is maybe near what you are trying to study. My recommendation is to go through and read some of these papers, and come up with more keywords through their work. Prevalence of depressive symptoms and its correlates among male medical students at the University of Bisha, Saudi Arabia. So this one is within our context, so it might be very relevant to what you're trying to study. Notice here there's a study, Flavanols in Action, targeting oxidative stress and neuroinflammation in major depressive disorders. Now, Nafisa, is this study, do you think just by reading the title, is it related to what the idea you're having? Yes. So notice here that it brings up things that are about depression, but maybe not the objective I'm trying to achieve. Okay, so here it becomes crucial to use more specific key terms. So for example, would you consider adding interventions? This way, it will remove some of the articles that are not relevant to what you are researching. Another way to make the search strategy more manageable is to use the filters that we mentioned earlier. So you'll say to PubMed, I don't want everything that's been published. I want anything that's been published in the past 5 years. Notice that the number has gone down by half. Okay. Let's see additional filters. Okay. You have to log in to do that. But in any case, here you'll notice that it shows you the search details. So it used depressive disorder as a major subheading, and it has more subheadings according to its mesh terms. Okay, so if you use that, it will help you see the categories within PubMed. Okay. Let's use the advanced search that I showed you earlier. What does mine look like now? Notice here. I first searched depression. I came up with this number. Then I said, I want students. Then I said, I want not just depression, I want major depressive disorder. It's lesser. I added students, medical students. I don't want college students. I don't want high school students. I want medical students. That lessened it further. And I included interventions. And then I said, you know what? I only want the last 5 years. You see how the number is lessening? Okay. So this is one way to go about your search strategy. The more you hone in, the better results you will get. Okay. And this process, honestly, it helps you clarify your own ideas. Okay. So sometimes you come in and you don't have a big idea, but through searching, you'll learn more and base your study on your findings. Okay, so this is super important. Okay. Let's do a new search. Jamal, if you are with us now, we're going to do a different topic. Do you have something from your work context that you can suggest? Or anyone, if you can suggest a topic, we can research it together. No? Okay, so let's do diabetes. No, the suggestion? Chronic kidney disease. Okay. Okay. Does this read the topics, the titles of the uh, um, search result, and tell me, is this close to what you were thinking about? Noreen? Okay, so you're thinking more about incidence of disease. The number has certainly lessened, but I'm not sure that we are closer to what you are suggesting, incidence, just from reading the titles. You might have to use something else. So this one seems relevant. Epstein-Barr virus infection on immunopathogenesis and racial incidence of the disease. This article seems relevant. I'm waiting for your comment, Noreen. Is IgA nephropathy an adult disease or pediatric disease? Okay, I understand now. So you want to know what is the epidemiology of chronic kidney disease, more specifically IgA nephropathy. Okay, so this one seems like a relevant article to you. Global Incidence of IgA Nephropathy by Race and Ethnicity, a Systematic Review. This would be a nice place for you to start reading. Okay, so let's say that I clicked on this article. It will take me to this page. Okay, in this page, it will give you all the details, of course, and it will share with you what keywords the authors used to describe their article. So you can get some idea here. Um, uh, if it's open access, you will get the full article. See? So this one is full article, Noreen. I'll put the link for you in the chat. Sometimes it's not free access, so you have to go through SDL. Just take a copy, paste the title of the article and search through Saudi Digital Library. It will show up for you. Okay. What I would do, Noreen, is I would read this one. It seems relevant to what you have just mentioned. I would go through it and see, have they made any comments about chronic kidney disease, how often IgA nephropathy is the reason for chronic kidney disease, and so on and so forth. But you cannot get this information readily. You have to read in the articles. And once you get a systematic review, it will help you quite a bit. Okay? Okay. Notice here, Noreen, you're still with me, صح? Okay. Once you start reading, you will ask, how did they select their studies so I can do what they did? If you read on, it says, when we found more than two relevant studies were identified by searching PubMed, which is the one we're talking about now, Embase, this is another one, Google and Google Scholar. Of course, I don't recommend you use Google or Google Scholar. They used the term IgA nephropathy incidence. So they didn't use and, they just wrote incidence directly. IgA and prevalence, IgA and epidemiology, incidence by race. So now you have an idea, Noreen, and to go back to the database and to use the keywords they used. So for example, if we use this one, IgAN epidemiology, there's a lot of studies, Noreen, if you're noticing, about the diagnosis of IgA nephropathy. Do you notice? Yes. So now what do we know about your topic? There's a lot that's written on diagnosis, ولا? And there seems to be a lot that's written about treatment. Do you see anything about the incidence and prevalence of IgA nephropathy? Here's one study, but it's number 15. What do we know about your topic, Noreen? What can you tell so far? Anyone can answer the question. I know there's a gap in the literature. So what Noreen is trying to explore, the incidence of IgA nephropathy, its relationship to chronic renal disease. We're not seeing many studies on this topic. What we're seeing is treatment, diagnosis. There's nothing on disease burden, for example, so far yet. So what does this tell me? It tells me that perhaps this is a gap in the literature. And Noreen's idea to do a search on this, to do a study on this is important. What if I say IgAN epidemiology and Saudi Arabia? Notice here, it's returned 58 articles. And let's read them. Renal histopathology spectrum in children with kidney diseases in Saudi Arabia. Okay, so not particularly about IgA. Glomerular disease in Western Saudi Arabia, 26-year experience. Epidemiological trends of glomerular disease in adult population. Glomerulonephritis disease pattern at Saudi Tertiary Care Center. Immunoglobulin A nephropathy, a clinico-pathologic study in a tertiary care center in Saudi Arabia. It seems that there's a need for the idea that you are proposing, Noreen, because I'm not seeing a lot of it, especially when I put the filter on for Saudi Arabia. So what the idea you have is an original idea. It's not been done. Okay, so now I know that because I did some searching and I noticed what kind of articles they are publishing on this topic. Okay, is it clear? The database is very easy to use. It's not difficult at all. It's just about practicing and trying several times and doing again, using different words, reading articles, seeing what they have done in order to characterize their work. So this is very important. Okay, let's take a break. We take a break for 10 minutes and come back and continue our course. We have, so far we've spoken about how to use Boolean terms, and I think the examples that we just gave are quite helpful for you to organize your own search. The database is very easy to use. As I've explained, I'm going through the slides quickly now. Fairly easy to use, and you have to do the terms. You have to go through the terms several times in order to come up with the right ones for yourself. Okay, so pay attention to this number, the search results. Make sure that you use several terms that are closer to your research, to your search objectives. Very, very important. It will be more manageable for you if you do that. okay? You should always aim to have around, if it's just a regular literature review that you're trying to do, you should be less than 100, definitely. Keep it around 50. If you can get 50 to 70 articles, that's more than enough for a literature review. If it's a systematic review, that's a different story, okay? As I've shown you, if you click on the article, it will show you the name, the title, the authors, and give you the abstract. If it's open access, it will give you access to the whole article. If not, through Saudi Digital Library and your institutional email. Okay? On the side here, you'll notice it was here. It will show you where you can find the full text. Oftentimes, it will show you the journal website. But for us, if you're signed in through SDL, it will take you there directly, okay? If it's available freely, it might offer you a PDF link for you to download, okay? One of the benefits of using PubMed, you can make an account for free, as I've mentioned, and you can develop your search strategy, and once you are satisfied, you can send it to yourself via email, or you can copy it as to the clipboard and paste it in a document or something. It will give all the information that you choose in a list. Okay, so that's very important. Okay, I've explained it fully, but if you go back to the website, you will find tutorials that explain in depth the use of mesh terms. So if you feel like you want to learn more about the website and what it offers, you can find it there. Okay, so is there any question on search strategy so far? Okay, so we covered most of these points, and we've taken examples on the database itself. Okay. Now, let's go to the last step, which is primary and secondary sources, okay? And then after that, we'll talk about plagiarism and things to avoid in research. In doing a literature review, there's a things that are written already and available to you to access freely, such as journals, television shows, radio shows, book chapters, newspapers. These are considered secondhand, okay? Tertiary sources help you narrow the general information or broaden the focus of your topic. Of course, I don't recommend that you use these in your research, but it's important to know that they are out there, okay? What about primary sources? This is the most important. The literature review mostly relies on primary sources. That means peer-reviewed journal articles, which are a description of studies written by researchers who conducted them. A primary source is written by someone who is a scholar, a scientist, and they belong to an institute, and they write according to their position. So usually they're researchers in a research center or faculty in a university. So let's take an example of a primary source. So an example of a primary source is the following. A study on patient experiences in the ICU, feeling safe, the psychological needs of ICU patients. This was published in the Journal of Nursing Scholarship. The volume is 32, and these are the pages. So this is something that someone conducted in their institute. It's about patient experience in the ICU and the psychosocial needs of patients. You'll notice that it's been published in the nursing scholarship, so probably was done by nurses. Okay, so it will take that vantage point, and it's something to pay attention to. Okay, what about secondary sources? Secondary sources are documents that have already been done, like the articles I just showed you in PubMed. Okay, these are written by people based on other research. Can you use them to conduct research? Yes, you can. So for example, the World Health Organization website has some details. The World Bank has other details that you can, information that you can do research on, especially in health indicators. So the title would sound something like this: Patients' Experiences of Being in an Intensive Care Unit, a Select Literature Review. So I already know that this is secondary data just from the title. Okay, so this is very, very important to pay attention to. Okay. What are the resources for literature reviews? You can use books, you can use journals, you can use conference papers, and I've mentioned earlier, you can use dissertation and master's theses. I, of course, don't recommend it if you have a short focused research project. يعني ما يصلح إنك use theses and dissertations. Only if you are doing a very large scale study and there's something really important that was written in a thesis, then you would do that. You can use encyclopedias and dictionaries, especially when you are providing definitions for diseases. This would be a good source for that. There are some publications, I'm not sure if you've heard of them before, called white papers. Okay, white papers are organizational documents that serve like research reports. These can be used as references as well, because they are produced from entities that are well known, like the World Health Organization, Wiqaya, the McKinsey consulting company. These are well-regarded documents, and you can use them in your studies. What about magazines and newspapers? It depends. You don't use them for a source of scientific information, but if you want to draw attention to, for example, a public health issue like rising temperatures, and you want to show readers of your article that this is a global issue, you can reference newspapers and news outlets to say that this is not just a major issue in the scientific community, but it is also an issue on a global scale. And here's the evidence. These broadcasting companies have made it a headline: CNN, Al Arabiya, BBC. But this is very rare for us to do because the projects we do are very small scale. So it's not usually something we do. But if you are more experienced as a scholar, you can do it. Okay. Nowadays, there's no such thing as paper-based searching. Okay. You use electronic sources. So as I've shown you just now, PubMed, and you go from there. Only people that I know of that use paper-based books are people who study manuscripts, old manuscripts and old books. And even then, nowadays, they have made digital copies of everything. So you can have access to almost anything online, which is a blessing, to be honest, but also very challenging because now you have access to a lot of articles, and you have to sift through what's important, what's relevant to you. Okay? Okay. It's okay to go through Yahoo search or Google and just to get some idea really quickly. It's okay. But it's not okay to base your written documentation on it. You have to be on PubMed to do that. Okay? It's important to do that. PubMed is often regarded as a medical database, but for me, I find that it covers all. There are some specific databases. I'm going to mention nursing in specific. They have their own database, Cumulative Index to Nursing and Allied Health Literature. This is a good database. I've used it before. It cites nursing literature only. There's also for psychology. So it's important to ensure that if you're in that specialty, to use that database in specific. The majority of these databases are free, but sometimes they have extra functions and it will be a paid service. Just something to keep in mind. PubMed is my go-to and I recommend it for anyone who's just starting out, okay? So, but very important to keep that in mind. There's also Cochrane. This one carries healthcare related literature. It's specialized in systematic reviews. And they have a very lively website with tutorials and webinars that you can benefit from. Also, there's ERIC. ERIC is for education research, okay? It's one of the largest sources for education information and it's free. So if you want to research something in medical education, this website will help you. Some entities have built databases that are significant to them. You will find particular research articles or conference abstracts depending on your interests. So for example, for me, the example I'm showing you now is for nursing. But for me, for example, I'm specialized in medical education. There's the AME, which is the Association for Health Professions Education. It's a global entity. They have their own website. In the website, they have journal articles and guidelines for education that you can gain access to through their website. يعني مو لازم أروح PubMed وبعدين أروح عليهم ولا أروح ERIC وبعدين I find them. I can go straight to the source. Okay, so this is important to know. My advice to you is to go ahead and search your specialty and ask what databases are unique to your specialty. You'll most probably find sources that are helpful. Okay, this is the one I'm talking about. This one is the American Psychological Association. Anything that's related to psychology or related disciplines may be found here. It's also a very good database if you're doing studies on behavior, human behavior, and these kinds of things. Every specialty has several publications, and each publication, peer-reviewed journal, has a unique link. So you can visit the journal straight away. Okay, so these are only examples from the nursing field. You can be partial to one journal and visit it directly. You don't have to go through PubMed. So this is an important point to highlight. These are more examples of databases. What do you notice? There's a lot of databases. We're not short of information. The skill to master here is how to get to the right information. Keywords, mesh terms help you do that. Okay. There's an important source that's conference papers and poster publications. It can be used as a reference, but do that sparingly because sometimes the quality isn't as good as peer-reviewed articles. So it's important to pay attention to that. These are more examples. It's important to know also that there are Saudi journals and there are Arab journals and there are Western journals. So when you're referencing your work, make sure that there's a mix of these journals. Don't focus only on American or Canadian and mention nothing from Saudi Arabia. It's important to be leveled. So these are some of the examples I've given earlier. Let's go back and review the steps for the literature review. First, you choose your topic. Much in the same way Noreen and colleagues have done. And then you identify the database. As I mentioned, PubMed is your go-to, but you can use others according to your specialty. And then you search and define your research parameters. So you first say, I want major depressive disorder and pediatric age group. No, I want medical students. No, I want nursing students, and so on and so forth. Then you have to read. Only through reading the titles, the abstracts, can you make your idea become mature, okay? Then you write the review. Okay, once you write the review, your ideas will be very clear, and actually you'll come up with more ideas to do research. Okay, so the circle feeds forward, and you can continue to produce more research according to what you have found. Once you have read, this is called an annotated bibliography. So it's not a referencing list, but where I started to read, just generally where has my reading been? Okay, so this is very important, and it's different from referencing. Referencing is when you take a particular piece of information and you use it, but a bibliography is something of more like a reading list. Once you have these references, you start putting them according to theme. So this one talks about biomarkers. So this is the biomarker file. This one talks about treatment. So this is the treatment file. This one talks about epidemiology. So this is the epidemiology file. Or more specifically, my studies about treatment of diabetes, then this file is about hypoglycemic agent. This one is about insulin. Okay, so it's important to recognize thematic organization. It helps you decide how your paper or your literature review is going to be written. So the majority of articles are on hypoglycemic agents, and then the second is about insulin and insulin dosage. That way you know how your paper will look, or your literature review will look. It will be under these themes. Third stage is you have to do more reading. So the primary bibliography helps you understand, but then as you write and you critically analyze, certain questions will come up. So you will ask for, I wonder if there was any paper written about the metformin and side effects in women over the age of 40. Because you read something interesting that talked about the metformin side effects. Based on that, you can go back to the search system and use specific keywords to find more articles in that regard. Okay, so the fourth stage is to write individual sections. As I've said before, once you have themes, these are your bullet points, and you can write each on its own. يعني مو لازم تكون you don't have to include everything that you read in your literature review. You have to make a decision. Which one is most important? Okay. Which one is most important, and which one's more relevant to my objectives? On that basis, I make the decision. Okay. Stage 5, you have to integrate. So you cannot just simply describe the what you read in the literature. You have to integrate it. So if it's talking about, for example, the side effects of a certain drug, you might say, okay, I'm going to talk about headache, and I'm going to say which drugs cause this as a side effect. Okay, and so on and so forth. So it's very important to integrate the findings and ensure there's alignment between the introduction and the body and the conclusion. Okay, I cannot emphasize enough the importance of drafting draft 1, 2, 3, 4. مو من أول مرة نكتب خلاص هذا هو اللي submission. No, you have to write and rewrite and have some feedback and delete something and go back to the drawing board. So it's important to recognize the stage as part of the process. It's not after the process. Okay, so what you need to see in your review is the introduction, the body, and the conclusion. Okay, what about the introduction? As I mentioned earlier, like any article you write, you have to identify the general topic. I'm talking about hypertension, define hypertension, point out the trends. It's very prevalent in Saudi. These are the numbers, and actually in the MENA region. And then you point out what has been published in terms of theory, methodology, and you tell us, is it strong data that's out there, or is it weak? Do we need better studies or no? Is there a new perspective that you would like to share that was highlighted in the articles? Here, it's important to communicate what you think as a scholar. Okay, this is very, very important. How you think as a scholar is crucial. Okay, again, you're not writing, this was a great article, this was a good article. That's not it. You write objectively. You say the methodology was strong because they had a high sample size. They used a validated questionnaire, but that makes their study stronger. Some studies, they don't use validated questionnaire. They develop the questionnaire without only face validation. So, and then, is this the same level as someone who has done something that is both valid and reliable and has been tested several times in different contexts? طبعا لا. So it's important to keep that in mind, okay? Once you finish the introduction, which is introducing the topic, making sure you point out the trends, giving a general opinion, and ensuring that your voice comes through in the introduction, in the body, you have to section off and ensure you're going through according to themes. So, for example, you can say the majority of studies used quantitative approaches. This study recommended so-and-so, and that study recommended such and such. But these are important ways of kind of summarizing the individual studies and ensuring that you reach a conclusion without taking up too much space. Okay. In the conclusion, you summarize major contributions of significant studies and articles. Okay, and you evaluate the current state. يعني لازم أسمع منك إنه okay, so what? Here you answer the so what. What gaps are there in their literature? You might find that most of the studies are observational studies, no cohort, no clinical trials, no experimental. So you have to say there are no studies in this fashion. It's very important to clarify that, okay? Okay. Any questions so far? Let's see this example. It's an example of a bad review. Why is it bad? Read it silently to yourself and tell me. Any idea? just for the sake of time, let me comment on it. Because they are not saying any conclusion. There's no analysis here. It's just saying, so-and-so did this study, so-and-so did that study, but they are not offering me anything in terms of synthesizing these results. So this is you just writing a description. It's not a literature review. A literature review is more critical. So let's see this one. This is an example of a good review. So I'm going to give you a moment to read it. Notice that it's shorter, you see? And it hasn't gone through Adam said this, and then Benson said this, then this final author said this. No, it actually said, you know what? The consequences of this phenomenon is lowered self-esteem, loss of self-confidence, withdrawal from social interaction, changed career goals, and depression. All of these authors اللي هم نفسهم اللي هنا mentioned at once. Now you are more concise and you gave me the essence of what happened. So you did some thinking when you read and you decided that they all agreed on this. Okay. But you might have read something in one of the articles that is interesting and that you wanted to share. You thought it was important enough to share. Here, he noted that 13% of women students, they said that they avoided taking a class or working with certain professors because of risk of harassment. Okay, so this is a very high percentage. So you would like to draw attention to it, in addition to what has been found in these studies in terms of consequences. واضح? You see the difference? هنا بس they're mentioning this guy said this professor said that, and so on. But here it did more. It created a theme of what are the consequences. They all discussed them. This one is most important because it's a high percentage. واضح? Be specific when you're talking in a literature review. You don't have a lot of word space. 5,000 words is not a lot to discuss all the ideas. Be selective. Just because you read and included articles in your search strategy doesn't mean you have to mention them. Only if it's very aligned with what the message you're trying to deliver. Okay. Focus on the current topic. When you read in the literature, there will be lots of topics that come up. Make sure you always go back to your objectives. Ensure evidence for claims. So don't say so-and-so said such and such and they didn't. Okay. And if they did, make sure to mention that it was a cross-sectional study or it was an experimental study عشان أنا أعرف كيف أتعامل مع المعلومة اللي أعطيت إياها. هل هي مجرد في institute واحدة? Is it one institute that did this? So I can't make a blanket statement and say these two diseases have a relationship just based on one study in one institute. Okay, so that's very important to keep in mind. Always reference your work. Don't make claims and not reference your work. Avoid abbreviations and jargon. Okay, so try to be very clear and straightforward in your language. As I've mentioned, English is not our first language, so it's not. It's very much okay to solicit the help of English language editing to help you deliver the message in the right way. And if you Google English language editing, several companies will come up that can help you. Organization. As I mentioned, write bullet points. And then you might even decide after you finish writing that this section, you don't want to have it anymore. Okay, so you can delete it and so on and so forth, okay? There's a very important mistake some of us make is we read a piece of information in a certain article and we reference that article, but the information did not come from this one. It came from something else. So make sure from a previous journal article. So if that's the case, make sure you reference the original reference. That's very important. Okay. The more sound your literature review is, the closer you are to achieving your objective for research. Okay. So it's the foundation of good research. If you can do a good literature review, I promise you, you will have a great project on your hands. Okay. What are the advantages of having primary research beyond doing a literature review? Do you stop there? No, you create new knowledge by engaging in primary research through questionnaires, interviews, focus groups, as I mentioned earlier. This creates new knowledge, okay? And it's more specific and it serves the context you're in. So imagine no one has done any studies on IgA nephropathy in your institute. You will be the first one. So it's not enough to do literature review on the topic. You have to go the extra mile and you have to conduct research within your own institute and on your own patient population. That will be a great advantage for you, your institute, and your patients. The challenges are not unbearable, so it is expensive and time consuming, but it's the natural next step after a literature review, okay? So it's important to ensure that you engage in that stage with a team that you trust. If you cannot do primary research, secondary research is less time consuming. The information is readily available. You can hop onto PubMed and go ahead and do it. You don't need any money. It does not require money at all. So it doesn't require any financial support. But you have to really make sure that the information is not out of date. This is very important, okay? Or that the information is copyrighted in some way. You have to ensure that you reference properly. Okay. Let's just keep going ahead into our next and final topic, which is plagiarism. We might need an extra half an hour to cover this topic. So bear with me because this is an important one. I know it's the end of the day, but it's important to pay attention to these aspects of research. What is plagiarism? You can write in the chat, just so I can make sure you're awake. Plagiarism is the act of stealing someone's work and passing it off as your own. So for example, you take an information from another article and you write it in your work and it's not your idea. صحيح. Other people's work الاقتباس الجائر. نعم. You need to avoid this completely. You cannot have this in your record. So if you read something in someone else's work and you are wanting to use it, you have to reference. حط quotations. نكتب بين قوسين الوزان 2020. Okay? This is not my work. This is someone else. I'm just referencing it. Okay? So this is very, very important. It's considered theft of someone else's words. Use of sources without attribution. So it's very important to avoid this at all costs. There's two types of plagiarism, intentional and unintentional. Intentional is when you do it on purpose. When you do this on purpose, this is called intentional, okay? Unintentional, sometimes إحنا بنكتب notes and we're writing notes and we're trying to keep bullet points. Sometimes we forget where this information came from. Or we don't write it in the notes. So and then we use the information and then come back to it and recognize that it's just a statement that I wrote and I don't remember who I'm referencing. Very, very important to be diligent. Most of us fall here, unintentional. No one does it intentionally, okay? So unintentionally, we try to put some information together or paraphrase, and we don't pay attention to referencing or what is our own idea and what is the idea of others. So be very careful not to fall into this unintentional plagiarism. Why do we have plagiarism? We haven't been trained for it. Maybe that's reason number one. In the same way, we haven't been trained for research in some schools. So in undergraduate level, we have to really educate more fully about the dangers of plagiarism. And nowadays, universities use technologies like Turnitin, and they try to educate their students on how to best avoid, especially when they submit assignments. The other reason is sometimes we are rushing to submit something. So we have short time and we're not adequately prepared, or we don't have the best English language skills. So we submit something and we end up falling unintentionally into plagiarism. The author isn't the only one that we blame here. The journal, peer-reviewed journals carry some responsibility. So they have a duty to review the work and make sure that they are publishing something that is of high quality. And if in case your work is not published in a reputable journal, that goes to show you that maybe your work isn't that great. So predatory journals that are not indexed in PubMed, avoid publishing there, because that shows you that actually they are not good. And maybe the work I'm doing isn't that great either. There are, luckily, anti-plagiarism tools. So before you submit your work, you can go to these websites and just run your manuscript, your review through it, and it will go and check it for plagiarism. One of the ones I use are Turnitin, plagiarism checker, and recently I've been using one called Grammarly. Of course, it's not free, you have to pay, but it's good. It suggests better structuring of the sentences, and it tells you exactly where where sentences are plagiarized. حتى يقول لك what reference. So it says it finds a sentence that you've taken and shows you where it found the statement in the other article. So, and it helps you paraphrase better or reference better. So that's very good. And you have access to that as a researcher. Okay, so مو معقولة إنه أنا يعني I'm going to be zero plagiarism, right? There are levels. So when you run your document through the plagiarism tools that I mentioned recently in the previous slide, it might come back with less than 10%. Okay, so it's minor. Usually if it's like this, we don't do anything. Okay, and level 2, it's 10 to 40%. Here, if it's a student at school or a master's student or a PhD student doing research, they will be asked to submit again. It will be returned to you, and the teacher or your supervisor will say, your research is 30% like other studies. So you have to submit again, okay? Level 2, if it's more than 50%, students are usually debarred, okay? That means they can't submit another paper because 50%, that means you really took someone else's work. It's not just similarities. Same goes for research papers. If you submit and the plagiarism is very high, you will be rejected from the journal submission system, and probably you will not be allowed to submit again because of this similarity. Okay. In schools, if the student reaches above 60%, and we're talking here about research done by master students and PhD students, they are risking their registration being canceled. So they will not be able to continue in the program if this is found out. So it's very important to ensure you understand plagiarism and the policies that are relevant to plagiarism. The same applies to faculty members, so it's not just students. If you have issues with publication, you will be reprimanded accordingly. And each university and each research center has their own rules and laws. So my recommendation to you is to ask in your institute what is plagiarism and what levels exist. But by and large, this is the way it's considered. Anything below 10, 20%, that's okay. 30 or 40, you're going to hear about it and you will be asked why. But beyond that, action will be taken. What happens if I plagiarize? Public disclosure. So you have to publicly say that I took the work of others and I am sorry for doing that. If you are someone who has research funds, you will lose the research funds. You might lose your job, especially if you're working in a research center where this is legal action is taken against individuals sometimes. So if you plagiarize someone's work, they might take action against you. Okay, so this is very serious. Be very sure that you take this into account when you are working on research. The idea is not to scare you, it's just to make sure you understand the gravity of the issue. Okay, now I know why it's serious. How do I avoid it? Take notes and keep them organized. Always reference, even when you're writing. Give other people credit. Cite the sources you see. When in doubt, use a citation. Okay, when you don't know, avoid mentioning this this point altogether. But if you are sure of it, make sure it's cited. And that way you can keep yourself protected. Okay, I have reached the end of this course. I'm sorry today was very long. I'm sure you have a full head now, but I am sure it's full with good information. We have covered the introduction to health research. The outcome of this is to understand and to begin to navigate the research world in a better way. You're not supposed to be able to write an article or to do a whole literature review, but you should be able now to go on to PubMed and search. And you should be able to have a conversation about the different ways research methodologies are done. So if you have any questions, let's take them now. زهير سليماني. زهير. يبدو لي إنه المايك ما يشتغل. I will take the next person and we'll come back to you if your mic works. كامل.
السلام عليكم، زهير السليماني معك.
حياك الله، تفضل.
الو.
Yes, we can hear you. أستاذ زهير نقدر نسمعك، تفضل بسؤالك. Okay, just write it in the chat. I can answer you in the chat. Okay, so I'm going to read the one I'm Riham. My master's research was in systematic review. Can I publish it in scientific journal? Yes. It's a very strong piece of work, Riham. يعني من أفضل مصادر المعلومات systematic review. So you should always try to publish it. What are the approved scientific journals that I can publish my research in? To start with, ask your supervisor and your colleagues in your field what journals they recommend. And ensure that these journals are indexed in PubMed. يعني لما تدخلين على PubMed, research the journals and see if it's listed or not. If it's not listed, it's not a good journal. If it's listed, it's a good journal. Each journal has an impact factor, okay? So the higher the impact factor, the better. But the more competitive it is to publish. So that's the way to appraise them. If it's not indexed in PubMed, you should avoid it. There is a publication fee in some of them if it's open access. If it's not open access, there is no publication fee. Oh, it's different. Some journals are 5,000 riyals, some are 10, 12,000. So it's important to pay attention. What do you mean audit committee? I would recommend that you give it to your colleagues and ask them to read and give you feedback and you adjust before you submit. Someone more senior to you, especially is this your master's research? Your supervisor has to be a co-author. Okay, so they are the first person to go to. Thank you all for attending. Okay, I think these are all the questions. If there's any questions left or